There's no draft match.
No. So like 2 words.
You should shut us in on something.
Oh, you should come up.
Yeah.
See what they get white.
Remember telling me like the all I have is, you know,
He doesn't have a phone.
Flip phone.
they're
You're loud and laughing, Dr. by the bus.
We'll try to That's different. I was there too. Yeah. I know. My friend's like, he's gonna be there tonight.
He's probably so
Professional, he's so professional. And you can tell he actually cares about what he does, you know what I mean? When people start coming in, you can't say nothing. No one, when people start coming in, you can't say anything. No cheering. Did you not hear what he said? When Dr. Whatever his naming comes in, can I clap? I said I wouldn't advise that.
That's what they said when he was setting it up.
All right, please.
Please be seated, folks. Say something to me. Ready for the jury?
Yes, Your Honor. Yes, Your Honor.
Please be seated, folks. We're back on the record after our evening recess. Good morning, ladies and gentlemen. At this point, the state may call their next witness.
Thank you, Judge. The state would recall Justin Brammer.
Morning, Mr. Brammer. New day, new oath. You swear or affirm the testimony about to give will be the truth, the whole truth, nothing but the truth?
Yes, sir.
Please be seated. Mr. Twain.
Justin, you stated earlier on record that you were the son of the defendant.
Yes.
Just have a few questions for you. Do you store tools for the defendant?
Well, they're my tools because he gave them to me. But yeah,
Okay. And what type of tools are those?
hand tools, air tools, big toolbox, air compressor, jack, just normal tools.
And how long have you stored those tools?
Over a year.
And have you ever sold any of those tools?
No, sir.
Never sold any tools during the 2 weeks that Eileen was missing?
No.
You ever give your father any cash?
No, sir.
No further questions, Sheriff.
Any cross?
No, Your Honor.
Thank you, Mr. Brammer. You may step down. State may call the next witness.
Thank you, Your Honor. State calls Dr. Kelly Cruz.
Morning, Dr. Cruz.
Morning.
You swear or affirm the testimony about to give will be the truth, the whole truth, nothing but the truth?
I do.
Please be seated.
Thank you.
Mr. Wilbur.
Thank you, Your Honor. Good morning.
Good morning.
Could you state your name? Could you state your name and spell your last name for the record, please?
Yes. My name is Kelly Cruz, Kruse.
All right. And how are you currently employed?
I am an associate state medical examiner at the Iowa office of the state medical examiner.
And how long have you been employed with the state medical examiner's office?
I've been in the office since July 2018.
Dr. Cruz, I want to talk to you just briefly about your education and experience. Where did you receive your, well, after high school, if you could just tell the jury about your education.
Sure. After high school, I attended Tulane University. There I earned a Bachelor's of Science in Anthropology. I then attended St. George's University. There I first earned a Master of Public Health degree, and then I attended their medical school. I graduated from medical school in 2013. Then I attended an anatomic and clinical pathology residency program that was located in New Jersey. And then I did a forensic pathology fellowship program at the Office of the Chief Medical Examiner of Maryland, located in Baltimore.
Okay. May I approach, Your Honor?
You may.
Mark the State's Exhibit 14B. Is that an accurate copy of your CV?
Yes, it is.
Offer 14B, Your Honor.
Any objection on 14B?
No, Your Honor.
14B is received.
Now, Doctor, I heard you say that you received a fellowship in forensic pathology.
Yes.
Can you explain to the jury what is forensic pathology?
So forensic pathology is a subset of pathology Pathology is a branch of medicine that predominantly looks at disease processes and how they affect the human body. Forensic pathology takes that a step further. There we look at disease processes and also injuries, and not only how they affect the human body, but how they can cause someone to die.
Okay. And are you board certified?
Yes.
Do you have sort of a standard operating procedure for how autopsies are generally conducted?
Yes, I do.
Could you explain to the jury what that process is?
Each autopsy generally has two main components. There's the external examination and the internal examination. The external examination starts with looking at the outside of the body and everything that comes with it. There we document medical therapy, clothing, anything else like personal effects that may come with the body. We then remove that clothing and medical therapy and then look at the body itself. As part of that examination, I document any defining characteristics. So I'll document hair color, eye color, someone has tattoos or scars, then any evidence of injury on the outside of the body. Once that external examination is complete, then the internal examination commences with a Y-shaped incision on the front of the chest and abdomen, and then each organ is taken out one by one. They're subsequently weighed and then examined for any evidence of injury or natural disease. The brain is also removed as well. As part of that internal examination, specimens are also collected. So vitreous fluid from the eyes, blood, urine if it's available. They're also collected and then tested for toxicology when appropriate. Once all of those organs have been examined, those specimens have been collected, then that's really the end of the autopsy. Those organs are returned to the body and the body is sewn up and sent to the funeral home.
Okay. And then I assume that you're also looking for evidence of injury in the internal examination.
Yes.
Okay. And would you do anything with microscopic slides?
Most of what we do in the forensic setting is looking grossly with the eyes. When appropriate, we will look under the microscope at organs as well. That's something I did in the autopsy that we'll talk about, and it's something I'll do whenever I feel appropriate.
And then do you sometimes send specimens off for additional testing at different locations?
Yes.
And was that done in the case of Eileen Gowan?
Yes, blood was sent off to a toxicology laboratory in Pennsylvania.
Okay, and what's the purpose of a toxicology lab analysis?
Toxicology is routinely ordered on the vast majority of our cases. It's looking to see any sort of blood or any sort of alcohol or drugs that are in a person's blood or whatever specimen that we send to see if potentially it contributed to a person's death.
Okay, and then I assume in some cases, I'm seeing like in baby deaths, you might have to send organs off to even further specialists to examine, like maybe a brain pathologist, something along those lines.
Yes.
Is that done?
Yes.
Okay. Nothing like that done in this case?
No.
Okay. All right. Then once you have completed your autopsy and received back any, external tests that you'd requested, what's your job then as a forensic pathologist?
So after the autopsy examination, I write my autopsy report, and then I'll wait for that additional testing results, the toxicology, if I ask someone else to look at a different organ. Once I have back the information of everything that I've ordered, all of the testing results, then I can come to a conclusion as to cause and manner of death. Once I've done that, I'll sign the death certificate and I'll finalize my report.
Great. So could you explain cause of death to the jury?
Cause of death is a specific entity like a disease or an injury that starts a sequence of events that ultimately leads to someone dying.
Okay. And then manner of death.
Manner of death describes the circumstances that surround a person's death, in contrast to cause of death, where really you can think of any sort of disease or injury. Manner of death, we only have 5 options.
And what are those 5 options?
The 5 options include natural, so death due purely to natural disease, suicide, so death at the hands of oneself. There's accident, death to unforeseen circumstances or hostile environment. There's homicide, death at the hands of another. And then undetermined, which is something we choose once you have all the information back that you need. Either you can't choose between 2 or you really don't have enough to decide between any of them.
And how many autopsies have you conducted in the state of Iowa since working for the state medical examiner's office?
Within the office for the state of Iowa, I performed over 1,300 autopsies.
And then during your training, how many autopsies would you have performed?
So total, counting my training, and then I also do some consultation work, I performed over 1,800 autopsies.
Now, I want to sort of drill down into the Iowa autopsies that you've conducted. Approximately how many of those 1,300 would have been due to natural causes?
In terms of, and I know we had talked about it, and I can't remember the exact number, in terms of my work at the state, the majority are usually due to accidental causes, like injuries, and then natural causes as well. As far as my consultation work, I do hospital autopsies. Those are all due to natural disease, and I've done a few hundred of those.
Okay. And then how many, roughly, would you say are suicides?
Suicides also comprise a significant number of the cases that I do. We're going into the hundreds.
Okay. And then I think when we spoke, you had indicated, and obviously that was maybe a couple weeks ago, that you believed you'd had 84 homicides, 84 autopsies that you had conducted where you concluded manner of death was homicide.
Was homicide, correct? And even more so within my fellowship training, I completed almost 100.
Okay. And I believe you said that was in Maryland?
Yes, we served the entire state of Maryland, and our office was located in Baltimore.
So you had a lot of homicides that you dealt with in Baltimore?
Yes.
Right. Okay. So probably a couple hundred
Yes.
overall. All right. And then how many undetermined autopsy manner of death do you think you've dealt with?
Far less. I don't know if I could give an accurate number, to less than 100. In general, it's the manner that should be chosen the least by all pathologists according to accrediting guidelines. Really, it's in rare circumstances.
Fair to say you don't want to say undetermined. You're hoping to have a manner of death like that you can classify, right? Homicide, suicide, natural causes, or accident.
Correct.
Okay. Now, as far as your, couple of hundred homicide autopsies that you performed, how many of those would have been gunshots?
The vast majority were gunshot wounds.
And it's fairly standard because the vast majority of homicides are due to gunshots here in America. Is that correct?
Correct.
Okay. And then how about stabbings?
In terms of stab wounds, it's probably the second most, I would say, common one that we see. I even did one yesterday.
Okay. And then blunt force?
Blunt force injury, probably next in line. I've done a good number of them. I couldn't say exactly how many, but definitely less than the gunshot wounds.
Sure. And then asphyxiation?
Asphyxiation in general in the entire country, from what I understand, is one of the least common ways for someone to die, at least in the setting of a homicide. I've done at least 5 to 10.
Okay. And then are there other, I'm sort of just trying to go back in my brain. What other, I suppose you could have a poisoning.
Correct.
Anything else?
Those are the main in terms of homicides.
Okay.
You can have other options when you're dealing with children and babies and things like that.
Sure. And then I would assume, like in the context of an accident where when someone dies in a motor vehicle collision due to alcohol use, like in the OWI context, would that be classified as accident or would that be classified as homicide?
If someone is intoxicated and they have a crash with another person, if there isn't any indication that that crash was on purpose, like they used their car as a weapon, then that manner would be classified as an accident.
Okay. That sort of gets me to, even when you say homicide, you're not opining that means it's criminal.
That's correct.
Right. So when you say homicide, that just means death at the hands of another.
Correct.
So it could be self-defense, right? It could be justified.
Correct. To me, that is just homicide.
Sure. It could be when we don't have capital punishment in Iowa, but if the state, takes your life, then that's also considered homicide. Is that correct?
Correct. Death at the hands of another.
Okay. At some point, you became involved in the death investigation of Eileen Gowan.
I did.
Okay. And do you recall when you would have first become involved?
I don't recall exactly when I knew about it, but the autopsy was performed on the 28th of February.
Okay. Well, we know from previous testimony she was found on the 26th of February. And is that fairly common? It would take a day or two then to get the autopsy performed?
Yes, especially definitely the next day, and then potentially another day after that. It depends.
Okay. When you received the body of Eileen Gowan, did you follow typical autopsy procedure?
I did.
Okay. And did you prepare a report?
Yes, I did.
Apologize, I didn't have your report stapled, so we're going to clip it together. I approach, Your Honor.
You may.
I'm handing you what's been marked as State's Exhibit 15A. Ask you to recognize that.
Yes, this is my autopsy report and the toxicology report attached.
Okay, does that appear to be a fair and accurate copy of your report?
Yes, it does.
I would offer 15A, Your Honor.
Any objection to 15A?
No, Your Honor.
15A is received.
Do you have a copy of the report with you?
I did bring one.
Okay, then I'll take this one back. So before I speak with you really about your the autopsy and the physical findings, can you talk to the jury a little bit about the importance of photography and the reasons that you do that with an autopsy?
So photographs are taken throughout the autopsy process from the very beginning when the body is removed from our cooler where it's stored before the autopsy, and photographs are taken until the very end. They're meant to document our findings so other people can view them. They're used in settings like this. And then they also help me as I write my report. I review the photographs and see if I missed anything or things might become more apparent when looking at a photograph on a computer. And then if I would like to share my findings with someone else, I use them to discuss the case.
Sure. Because with if a person was going to look for a second opinion on a medical opinion, like if you're going to a cardiologist because you've got a heart issue and you want to go to another cardiologist, right? The patient just walks in and talks to the other cardiologist. Correct. Is that correct? A little tougher to do that in forensic pathology. That's
true,
right?
yes.
Because once the autopsy is completed, then the body is no longer there.
Right.
And so is that one of the reasons why it's very important to document photographically what you're observing?
Correct. Really, all I have once the body is gone is my report and the photographs.
Sure. Okay. And I'm going to show you some photographs. These are not just for the benefit of all. These are just clothing items that were seized. So, is that part of the process? You would take pictures of her clothing as it's removed?
Yes, it does depend on what kind of case it is and if I think it's appropriate.
Okay. And was that done in this case?
Yes.
All right. So 7 through 7I. May I approach, Your Honor?
You may.
Show you Exhibit 7, and then 7A through 7I. Do you recognize those?
Yes.
And do these appear to be photos that were taken of her clothing at the autopsy?
Yes, they do.
I'd offer 7 and then 7A through I inclusive.
Any objection to 7 and 7A through 7I inclusive?
No, Your Honor.
Okay. And once again, these are just photos. Photos of the clothing, but request permission to publish, Your Honor.
And first, they are received.
Oh, sorry.
And yes, you may publish.
Sorry, but thank you, Your Honor. Could you put 7 for me? Try to go through these fairly quickly.
I don't think it's your screen, is it? I'll confirm it.
It's not. There we go. All right. So just she had one shoe.
Correct, on her right foot.
Okay, and I just, on all of these pictures, we'll go through these pretty quickly. It's just you're the only one we're speaking to about the clothing, so that's why I have to do this.
Sure.
I see a ruler off to the side that has a number on it. Is that your office's internal control number?
It is, and the ruler with the number should be in every photograph.
Absolutely, right. So that's one of the reasons you know these are your photos, because your autopsy report indicates that it's case number 23-01865, and the ruler is the same.
Exactly.
Okay. Go to 7A. Just the bottom of the same shoe?
Correct.
Okay. 7B. Okay.
And these are socks that she was wearing.
Now, I don't know if you can tell from this, was the sock that appears to have some leafy debris on it, was that the one for the foot that had no shoe?
I think that makes sense, but they're not marked in the photo.
Sure. Okay. 7C. Underwear she was wearing?
Yes.
Any damage to those that you had seen?
Not that I had noted.
Okay. 7D.
These are the blue jean pants and the belt she was wearing.
Okay. 7E.
Then this is the back of the same clothing.
7F.
This is the jacket that she was wearing, the front of it.
And that discoloration, would that be wet? It's water. That's not blood or anything. That's moisture. Is that
Correct,
fair?
that's moisture.
Okay. 7G.
That's just the posterior aspect of the jacket.
Okay. And once again, that appears to be mostly damp, right? You can see some dry on the shoulders, but again, the discoloration is not due to blood or anything. That's just moisture.
Correct.
Okay. And then 7H.
She was wearing a sweatshirt underneath her jacket, so this is the front of it.
Okay. And then finally 7I.
And this is the back of the same sweatshirt.
Okay. May I approach to retrieve the photos from
You may.
Thank you. Right. Before we start getting into actual autopsy photos, I want to just talk to you, just go through your report, with you. So if you have that in front of you, we start with, when we publish 15A, her report.
You may.
So let me just scroll up here a little bit. So obviously we see the case number, and that's indicative of the same ruler that you had. I want to let's need to go a little farther. Here we go. So I want to talk to you first about evidence of injury. So you have, can you tell the jury what injuries that you found?
So a number of injuries were found, mostly on the external examination portion. At the top, I had listed a laceration and contusions of the scalp. She had a laceration, which is a tearing of the skin on her scalp, on the left sort of frontal scalp near the hairline. That involved the full thickness of the scalp, and there's actually a slight sort of divot taken out on the skull beneath it. In terms of additional injuries on the scalp, those were better appreciated once the scalp was reflected to remove the brain. She had a number of contusions or bruising on the scalp. They were in the frontal region, more toward the front, at the top of the head, and then she also had contusions at the back of the head.
Okay, so when you say a contusion, as a layperson, I would say a bruise.
Correct.
Right. So she had contusions really all over her scalp. Is that?
Yes.
Okay. And can you explain to the jury when you say reflect? I know, but I don't know that they necessarily know when you're reflecting the scalp, what that means.
Reflecting the scalp, so in order to take the brain out, an incision is made over the top of the head from ear to ear, and part of the scalp is pulled forward and part is pulled back. So the top of the skull can be removed, and then that skin can be brought back. So really, you wouldn't be able to tell that we took the brain out. So when that scalp is brought forward, I'm able to see the underside of it, and there it's easier to appreciate a bruise because then the hair isn't obstructing my view.
Great. And we'll show the photos later, but thank you for that. Then we've got B, we talk about abrasions and contusions of face, right ear, neck, torso, and extremities. Explain your findings, please, to the jury.
So these are more blunt force injuries. So they're injuries that occur with the impact of any sort of object with the flat surface. So the laceration was one of those, the tearing of the scalp. And then she had the contusions or the bruises. And then abrasions are a third sort of category within blunt force injuries. Abrasions are just really another word for scrape, where the top layer of skin is taken off. So she had abrasions and contusions of her face. She had a contusion or a bruise on the left side of the forehead. And then below that, she had an abrasion. She also had an abrasion on the right ear. And then she had an abrasion, which part of it had a patterned appearance that'll be appreciated in photos, on the left side of her neck. In terms of additional abrasions and contusions, she had a number of contusions or bruises on her extremities, so her arms and her thighs and her legs. And then she also had another abrasion on the left wrist sort of forearm area. In terms of injury on her torso, so her chest, abdomen, and back, she did have contusions on the left side of the chest, the right side of the back, and then I can't remember if it was abrasion or a contusion on her left hip.
Fair to say, well, let me get you to C, and then I'll maybe ask for a summary. You also indicate she had a fractured tooth?
Yes.
Okay.
She had a horizontal fracture in terms of the two middle teeth, the left one on the upper mouth.
Okay. And so was it obvious to you in your examination that she had been assaulted?
In terms of assaulted, she had sustained blunt force injuries, so there was an impact with some object, whether it was something hitting her hitting something is difficult.
Sure, and it happened multiple times in multiple places.
That's correct.
Okay. Now, in terms of when you have pathological diagnoses, you start with 1, right? What's the significance of 1 versus 2, 3, 4, 5, 6?
Ultimately, their order is really my choice in terms of what I want to highlight. So in terms of all of my findings at autopsy, I thought it was most important to highlight these injuries.
All right. So that, in your opinion, those were the most significant in terms of preparing your report?
Correct.
All right. And then you indicate number 2, give it a shot, hypertensive, atherosclerotic cardiovascular disease.
That's it.
Did I do okay? All right. Explain your findings with regard to with number 2.
So in terms of, hypertensive just means high blood pressure, and then atherosclerotic means a hardening of blood vessels. So she had hardening or calcification of the aorta. So that is the major blood vessel that takes blood from the heart to the rest of the body. And then she had hypertensive changes or signs consistent with high blood pressure in her kidneys. That's what that nephrosclerosis means.
Okay. Would those have caused death in this case?
No.
Okay. And then looks like she's got pulmonary emphysema. What did you notice with regard to that?
So emphysema in the lungs means that the air spaces are larger. It's often associated with smoking. At autopsy, you can actually kind of feel, it's a crunchy sort of feel in the lungs, and that just means a lot of air is entrapped in those larger spaces.
Right. And did you understand Eileen to have been a smoker?
I did.
Okay. Uterine leiomyomata?
Yes.
Am I close?
Yes.
Okay.
And then the more common term is a fibroid. So those are benign smooth muscle nodules within the uterus. So more of an incidental finding than anything.
Sure. And then once again, the emphysema and the fibroid, not a cause of death in this case.
Correct.
Okay. Then you note mild decomposition of skin and internal organs and evidence of post-mortem animal scavenging.
Yes.
What can you explain to the jury the significance of these?
So in terms of our findings, when we're doing that external and internal examination, I'm looking for evidence of decomposition. After a person dies, decomposition pretty much starts right away and just becomes more and more evident over time. We see a number of different changes like discoloration of the skin. We get what's called marbling or web-like red or green discoloration on the skin as well. The skin can start slipping off, and other findings, there's bloating and things like that. So I did have some of those findings here indicative of decomposition that had been setting in and had been noticeable. In terms of the postmortem animal scavenging, it's something that we see when a person has been outside. So the right side of her face, the soft tissue, and her right eye were not present due to animals eating it.
Okay. And this happened in February, correct?
Correct.
So I would assume cold weather would slow down the decomposition process?
That's correct.
So I know that it's tough. You'll get asked as a pathologist, I think, frequently, can you estimate the time of death? That's pretty hard.
It's very hard. There are just so many factors, such as the temperature and the person's body temperature, where they are. It's very difficult.
Okay. So how close would you feel comfortable saying she'd been outside for how long?
So in a cold environment and she's showing signs of decomposition, you would then be, if you wanted to assume that she were out there the entire time she was dead, classically more than a day. But not knowing exactly where she was, the environment the whole time is just really difficult to say.
Sure. For example, someone could be frozen, right? I mean, if the weather was very cold, then that would really slow down the decomposition process. That's fair?
Yes.
All right. And then as it thaws, that's going to speed back up.
Exactly.
Anything having to do with the animal scavenging? Are you familiar with animal activity? Is that, like for rodents, does that decrease or go away as the weather gets colder?
I just suppose it would be what kind of animals are in the area. I'm not terribly well versed on that.
Okay. Would you say that her state of decomposition helped or hindered your findings in this case?
Any degree of decomposition definitely has the potential to hinder my examination. Her missing part of her face definitely did not help.
Sure. I mean, you couldn't take a look at her right eye because it was gone.
Exactly.
Right? And if she had any sort of trauma to the face that was not a fracture but was contusions like you noticed on the left side, because I think you indicated right ear had a contusion?
Had an abrasion,
Abrasion,
yes.
Okay. But if she had any other damage to her face on the right side, you would not have been able to see that because of the decomposition and animal scavenging.
Exactly.
Okay. Any evidence of sexual assault that you found?
No.
Okay. And we'll go through your report again, but I just want to make that clear. So, all right. Now, when you send off something for a toxicological analysis, what are you initially looking for, or what's the lab looking for?
The lab will initially do a screen, and it's at my direction. So in this case, I ordered an expanded panel. I believe it's hundreds of different drugs that they'll look for. They'll do a screen, and if they have something positive, then they'll do later confirmatory testing. In this case, I also had them send it to a reference laboratory to test for even more drugs.
Okay, and that was because you were sort of stymied. I know we'll talk about cause of death, manner of death, but you were sort of stymied, right, on like what happened to Eileen.
Correct.
And so one of the things you suspected initially, is it fair to say, was potential of some sort of drug overdose or even a poisoning?
Yes.
Okay. And so you ordered not only, you had regular toxicology, enhanced toxicology, and even a reference lab. Is that
That's
fair?
correct.
Okay. All right, now I want to sort of turn to, let's go to the next page if we could. I noticed here toward the bottom of, I'm not very good with these. If you just scroll that, there we go. But that's good. Bottom paragraph of page 2. Obviously talking about the right eye being gone. The left eye globe is desiccated. It just means dry. Is that drying out?
Correct.
Okay. Which would be normal if you're deceased and your eyes open, right? It's going to dry out through.
And part of that decomposition process as well.
Okay. And then you note no petechial hemorrhages are present.
Correct.
Can you explain what a petechial hemorrhage is to the jury?
A petechial hemorrhage, we classically look for them in the eyelids, near the eyes, the mouth, but really they can happen anywhere. So they're pinpoint hemorrhages that occur when a small, fragile blood vessel becomes distended with blood and bursts. That occurs when there's irregular sort of blood flow to that area. And we classically look for them in the face region because blood flow can be hindered or altered in the neck region. So if there's pressure on the neck, the blood vessels that drain the head are occluded first. So you're getting blood flow to your head, but it's not draining out. And that's when those blood vessels become distended with blood and they can burst. So that's something I look for in all of my cases. It's not necessarily indicative of a pressure there. It could be something, hindering blood flow from the heart, but it's something that's always made note of.
Sure. And I wanted to make clear. So when we're talking about like the major vessels of the neck, we've got the carotid arteries. Is that correct? And that's
Correct.
what's taking blood up into the head.
Correct.
And then we got the jugular veins, which are draining blood from the head.
Correct.
And I think I heard you say that if you have pressure applied to your neck, it would cut off the jugulars first.
Correct.
Right? Because the carotids lie deeper.
They lie deeper and they have a little more structure to them.
And is that why it is common to see petechial hemorrhaging? Is because you can have pressure that stops the jugular veins from draining. It's not enough pressure to keep the carotid arteries from pumping blood to the brain. And so you've got that increased pressure. Blood's still going up, but it's not coming out.
Exactly.
And that's what causes the capillaries to burst.
Correct.
Okay. All right. You indicate that she's partially frozen. Is that fair to say when you examined her?
Yes.
All right. And you had examined her, it looks like on the 28th, which is 2 days after she was found.
Yes.
What's the temperature of your cooler?
Our temperature of the cooler is normally set at about 37 degrees Fahrenheit.
Okay. So it's definitely not below freezing.
Correct.
Right. So in 2 days, she would have even thawed out somewhat.
Correct.
And so even after 2 days, she was still came to you in a partially frozen condition. Is that accurate?
Yes.
Just trying to see what else to talk to you about before we get into photos, because I'm trying to minimize having those up. Let's talk about, I know that you had some findings with regard to her having a fatty liver.
Yes.
Can we explain to that the significance to this jury about what that meant to you?
So she had fatty change in her liver, most evident when I looked under the microscope. Grossly, when I look with my eyes, it tends to have a yellow discoloration, no decomposition, colors just change. So when I looked at her liver under the microscope, she had these bubbles in the cells that make up the liver. That's indicative of fat is normally there and it gets washed away from the whole process of processing the tissue. There are a number of different reasons a person can have a fatty liver. Alcohol abuse, obesity, diabetes are some of the reasons.
Okay. So she was not obese.
Correct.
Is that fair? And you did have some indication that she'd had some alcohol abuse in her past? Okay. Did you notice any cirrhosis of the liver?
No, I did not. Just fatty change.
Okay. And you can have what we call NAFLD, right? Non-alcoholic fatty liver disease.
Correct.
Right. And it cannot occur in people that are not obese.
It most commonly causes in people who are obese. And if you have another reason for it, you tend to point the finger in that direction.
Sure. Okay. Anything about her fatty liver that you saw that would have caused her death?
No.
Okay. And it looks like she's missing a breast. Is that correct?
Correct.
And that was a previous mastectomy?
Yes, for cancer.
Okay. Again, anything about that would have caused her death in this case?
No, I didn't find any evidence of cancer going anywhere else.
Okay. Now I want to talk about your toxicological analysis. Right. So after you've sent it out for the toxicology and then expanded toxicology, and I'll say super expanded toxicology, what findings of note did you have?
So blood taken from the heart was sent out, and from that initial lab, nothing came from the reference lab. She had a prescribed medication and some other findings. In terms of the prescribed medication, she had bupropion, also known as Wellbutrin, which, looking through her medical records, was prescribed to her. She had a breakdown product of it. She also had caffeine and then nicotine and its breakdown product, codeine, as well.
Okay. Any alcohol in her system?
No.
Okay, so 0% alcohol.
Correct, 0 in her blood.
Can you explain how the body processes alcohol? Obviously, if you take a drink, drink a beer or a shot, our level is going to go up. Mm-hmm. Then at some point, right, it has to come down.
Correct.
How does that process work with the body?
Your body metabolizes alcohol through the liver. So once you drink that alcohol and it's in your bloodstream, it works its way to the liver where it breaks it down into other products, and eventually you excrete it through your urine. There are a number of different equations and things to say how quickly you metabolize alcohol. Everybody's kind of different. So that's just kind of the standard process of how your body works with alcohol.
Sure. Does your liver keep on working after you're dead?
The liver would not keep metabolizing the alcohol. In the postmortem setting, alcohol or ethanol can actually be created, sort of fermentation process with the bacteria in the body.
Okay, so you would not expect, once a person dies, liver function ceases.
Correct.
Okay? So it's not that you could die at a 0.1 and then 2 weeks later be found at a 0. Is that fair?
That's fair.
And Wellbutrin or bupropion, that's can be an antidepressant.
Correct.
Is that fair? Also can be used to help with cessation of smoking.
Correct.
But variety of legitimate prescription reasons to have that in your system.
Yes, and she was prescribed it for my records.
All right, I'm going to turn to autopsy photos at this point. I'm just making that sort of clear for the record for anyone that knows that's coming. May I approach, Your Honor?
You may.
Before I approach you with these photos, Doctor, you gave us an email of various photos that you believe would be helpful to you in your testimony. Is that correct?
Correct.
All right. And then you're aware that Dr. Michael Bodden had also conducted a review of this case.
Yes.
Is that correct? And so he's requested some photos as well, so you may see some additional ones. But you would expect your photos to all include your ruler in there. Is that correct?
Correct.
Okay. Approach, Your Honor.
You may.
I'm going to hand you what's been marked as 8 and then 8A through 8Q inclusive. And if you could just take a look at those. I'll go ahead and let you keep those.
Okay.
You may refer to them, might be easier than the screen.
Perfect. Thank you.
Do those all look familiar to you?
Yes, these are all my autopsy photographs.
Okay, and they fairly inaccurately depicted. They are the photos that you took at autopsy.
Yes.
Okay, I would offer 8 as well as 8A through 8Q inclusive.
Any objection to 8 and then 8A through 8Q inclusive?
No, Your Honor.
All those exhibits are received.
All right. Request permission to publish, Your Honor.
You may.
Okay. my notes tight. Okay. If you could put up 8. All right, so what are we looking at here, Doctor?
So when the body is sent to us and placed in our cooler, it's confined within a bag the entire time. On the zippered portion of the bag, a lock is placed, which is that blue item in the center with the numbers on it, and then a tag indicating who is in the bag. Before the autopsy begins, a photograph is taken of that lock to show that it's still intact, and that tag as well before the lock is broken and the bag is unzipped.
Okay. So that just indicates that the body has not been tampered with, right? Because it's been sealed the entire time it's been in your custody.
Yes.
Okay. 8A.
So after that lock is broken and the bag is unzipped, a photograph is taken of the person exactly as they were received by us. And so this is that photograph sort of as is received before anything is done.
Okay. And so you would be obviously viewing her with the clothes on, and then you'll remove those. And okay.
Yes.
Let's go to 8B.
This is another photograph that's sort of as is photographed, just due to the nature of the body usually occurs in 2 photos.
Okay. And looks like obviously she's missing her shoe.
Yes.
So this one indicates that. Okay. 8G. Okay. What are we looking at here, Doctor?
So this is a photograph of the body after that clothing has been removed and the body has been cleaned. So this is just her as I was doing my external examination.
Okay, and then obviously this is the indication of the damage to the right side of her face.
Correct.
Right. And then as we see that dark, may I approach, Your Honor?
You may.
I don't have that stick. This is the, that's that indication across the neck that you'd said had an abrasion with some periodicity.
Yes.
What does periodicity mean?
So it's trying to describe when you have an abrasion or that long scrape, there's areas where there isn't scraped skin or there's intact skin. So you have an abrasion, a space, an abrasion, and a space.
Okay. And so, for instance, you'll see that if somebody has a serrated knife and, scrapes up against the skin, and it can show, that's that regular intervals, right?
Areas of sparing in between.
All right. Or a zipper could do the same. Is that correct?
Correct.
Okay. Let's put up 8H. Okay.
And then this is the lower half of the body after the clothing has been removed.
All right. Anything of significance in this photo?
So part of that decomposition process, we have what's called marbling. Most prominent here on that right thigh, those sort of wavy lines, that's in the pattern of blood vessels, and the bacteria in your body interacts with the components of your blood and causes that discoloration.
All right. So that's not evidence of injury?
No.
Okay. It looks like she's got some bruises around her shins, knees, ankles. Is that what you're saying? Those are contusions?
Yes, she has contusions on both of her lower extremities, mostly on the front side that we can see here on her shins and her ankles.
Okay. That's what 8H. Let's go back to 8C. Okay. Close up of her face.
We call this our identification photograph. So it's just front and on of the face. The animal scavenging is apparent on the right side of the face. And here we can appreciate the fractured tooth. It's that horizontal line on the left, in the middle left upper tooth.
Okay. And then is that a contusion toward the top of her forehead? So I guess it'd be the left side, but the left side upper forehead, is that a contusion?
Yes, it is.
Okay. 8D. Okay. What are we seeing of significance here?
This is looking at the right side of the neck. So this is more a sort of photograph showing that there really isn't anything there that I could tell. What happens after you die is you get skin slippage, so that top layer of skin can come off. similar concept to abrasion, but once you're dead, you just see some white underneath. And so that's kind of where those little white areas there.
Okay, so those white lines, those are not indications of injury.
Correct.
That's just skin slippage due to decomposition.
Yes.
Okay. 8F. All right, so what are we looking at here?
This is the left side of the neck. So this is where that injury was, that abrasion that had the periodicity or a pattern sort of appearance to it. It's almost horizontal, curves a little bit, goes from like 9:30 to 3 o'clock along her neck. So it's an elongated abrasion, but there are areas where there's sparing in between, where it's red abraded skin, normal skin color, red abraded skin.
Okay, 8K.
And so this is a close-up of that abraded skin. In certain instances like this, they'll use different types of rulers. If someone wants to compare that injury to maybe some sort of object, the angled ruler with the circle helps them so it's oriented and then they get the perfect sort of view for comparison.
Sure, and that's important, obviously, because once again, the body is gone after you're done with your examination. So standard practice for forensic pathologists would be you want to document well, both in writing and with photography so that somebody else could take a look.
Exactly.
Whether it's somebody like my office or another doctor.
Correct.
Okay. Go back to 8I. Okay, what are we looking at here?
And this is that laceration. I was on the left frontal scalp near the hairline. That sort of upside down L-shaped defect in the scalp in the middle of the photograph. That white underneath is her skull that you can actually see through the scalp.
Okay, and when we say laceration, I sort of feel like it's, I think, slice, but it's actually blunt force that is like split the skin. Is that fair?
That's fair. There's a very distinct difference between a cutting wound, which is what people normally think of, and this laceration, which is the tearing of the skin. The tearing of the skin is from impact with a blunt object with a flat surface, and then a cutting wound is with a sharp object like a knife.
So when somebody gets, for instance, gets punched in the eyebrow and their eyebrow splits, that's not you'd call that a laceration because it was blunt force that caused that to happen.
Exactly.
Okay. And then you've got cutting or slicing and versus stabbing, which would be more penetration.
Right. The difference between a cutting wound and a stab wound is a stab wound goes in deeper than it is long on the skin, and then vice versa for a cutting wound.
You didn't notice any cutting or stabbing wounds?
No.
Right. Okay. Let's go to 8M. Okay, what are we looking at here?
So this is that reflected scalp that I had described earlier. So that incision is made over the top of the head from ear to ear. On the left side of the screen is that front of the scalp that had been pulled over. So it's kind of going over her face. And then on the right side of the screen is her actual skull. There's that hole in the scalp that you can see on the left side. That's that laceration. And then corresponding to it, if you were to kind of picture it being pushed back, there's sort of a divot taken out on that outer part of the skull.
Okay. So my understanding is that the skull has 2 layers of bone, right? So this wasn't a full thickness fracture, but it did basically take off the top layer of the skull.
Correct. There's nothing on the inside of the skull and no injury to the brain.
Okay. And that's why that wound would not have been fatal in itself, in your mind.
Correct.
Okay. Now we see already some other red spots on the skull, both on the scalp and the skull. Can you explain what those are to the jury?
Those red spots are those contusions or bruises of the scalp, which weren't apparent when the hair was covering the scalp, but are quite clear once that scalp has been reflected. So the contusions are on the scalp to the left of the screen, and then there's some bleeding underneath the scalp that kind of sits on top of the skull on the right side. And once you pull that scalp back, those match up with each other.
Okay. And those are all indicative of some blunt force trauma on her head.
Correct.
Okay. 8N. Okay, and what do we have here?
This is looking at the top of her head, so the reflected scalp is on the right side of the screen, and then the rounded white component is her skull. Here we have more of those rounded red contusions of the scalp, and then the underlying bleeding on the skull to the left.
So again, you can see, and these are all, they appear to have some, they're not circular, right? They're if you've got you say horizontal versus longitudinal or vertical, but they have sort of do they seem to have a directional component, or is that just normal how it would bleed through your scalp?
They have an elongated appearance to them, with contusions in terms of them representing like what caused them. That they're not very helpful compared to other sort of injuries.
Okay. Could a fist cause that?
Anything with a flat object or flat surface could.
Handle of something? I mean, just anything. It's not a sharp object. It's a blunt object.
Correct.
Okay. An 8-0. All right, what are we looking at here?
So it's part of the internal examination. We look at the structures of the neck after we take the brain out and all the organs. So we're looking at the strap muscles of the neck. You have all these elongated muscles that are on top of each other, and they can actually be separated out. So this is what I'm looking at here. And I'm looking for any evidence of injury because I do have that abrasion on the surface of the skin. And so I'm looking to see if there's any internal injury corresponding to it. So on the right toward the top right of the screen would be where her head is. And so there's sort of a V-shaped portion of skin that's pulled up. And then all those pink strands with the greenish discoloration are those muscles that have been reflected. Each of those muscles, looked at them one by one. None of them had any evidence of injury. That green discoloration is from decomposition.
Okay, you can take the pictures down now. I think at least for the moment, that's it for the pictures, Doctor. So just want to let everyone know that. So as I want to talk about that last photo just without having it up there any more than we have to. So you did not notice any damage internally that would have been, indicative of that kind of force to the neck. Is that your?
Correct. There's no internal injury to the neck.
So no damage to the larynx or the hyoid bone or the strap muscles?
Correct.
All right. And in your opinion, is that one of the reasons that complicated findings in this case? Because you're like, well, it looks like something on the neck, but there's nothing underneath it.
Correct.
Okay. Now, I want to talk to you just a little bit about ligature. Right? So, first I'll let you explain to the jury, what is a ligature mark?
A ligature mark is something we classically see in a hanging. So someone puts something around their neck, say it's a rope, then they suspend themselves in some way, and that ligature or rope is sitting on their neck for a period of time, and then there's some pressure because there's at least part of the weight of their body on it. That ligature, say for a rope, for example, will leave a mark all around the neck. It's usually like a yellow to red color, and that top skin is abraded, so it's taken off. Even after that ligature is removed, if it's on the person for any considerable period of time, that ligature mark remains. So I'll see it at autopsy no matter how much time has gone by.
Sure. And would it be fair to say that the thinner the, let's say, rope that would be around a person's neck, the thinner that is, the more prominent a ligature mark would be created?
Yes.
All right, because if you are, you have a thin rope, it's going to create a very thin, a marked ligature. Is that fair to say?
Yes.
And then as an object gets bigger, then the force is dissipated, and so you're going to get a less significant ligature.
Correct.
Now, on the, I'm talking a little bit about just sort of the asphyxiation, especially in the context of a homicide, as opposed to somebody hanging themselves. Mm-hmm. Is it fair to say that you would expect to be looking for signs of a struggle if someone is being, if they're being choked or strangled, or something, that you're going to be looking for those types of injuries, because a person is not going to just allow themselves to be asphyxiated.
Correct.
Okay, and so as a forensic pathologist, that's something you're going to look for?
Yes.
All right. And so would you be looking for like damage to fingernails or even like clawing at your own neck, something like that? Are those factors that you'd be looking for?
Yes.
All right. I assume, obviously, if a person's unconscious at the time that they'd be asphyxiated, they would have no ability to struggle.
Correct.
Right. Okay. And sort of staying on the asphyxiation topic, if a person has both their jugular veins and carotid arteries bilaterally, both sides, if they're all compressed simultaneously, how long would it take a person to lose consciousness?
Really just a matter of seconds before they lose consciousness.
I think, I think we talked to jury selection a little bit about my cohort here. It takes jujitsu lessons, right? And you'll see people get choked down. They call it, I always called it the sleeper hold back in the old days. I think now they call it the rear naked choke, right, with MMA. But a personal, you can get a neck into the crook of your arm, and that's why, and they lose consciousness pretty quickly, right? Like, could be 3-4 seconds.
Yes.
Okay. And would you expect that if a person had that type of force with like a crook of an arm, I don't want to demonstrate on poor Paul here, but if I had somebody here and was doing that, would that leave would you expect that to leave a ligature mark?
No, unlikely.
And I know that that you and I spoke on the phone, and I think for you it was troubling that there was no petechial hemorrhage in this case. Is that fair?
Yes.
All right. And is that because with manual strangulation cases, usually a person can have enough pressure to occlude the jugular, but they don't have enough pressure to occlude the carotid arteries?
Correct.
Okay. And that's why we get petechial hemorrhaging, because the carotids are still high pressure pumping blood into your brain, but the jugulars are unable to drain, and that's why we get the petechial hemorrhages.
Correct.
But when you occlude both carotids and jugulars simultaneously, then is it fair to say you would not generally get petechial hemorrhaging, or at least you certainly may not get petechial hemorrhaging?
You may not if that pressure is consistent.
All right. And have you seen that, in fact, in hanging cases, that people will actually commit suicide by hanging and they don't have petechial hemorrhaging?
Yes, if a person is fully suspended so their entire body weight is on that ligature, then you usually do not see petechiae.
Sure. Okay. And again, you had no signs of petechial hemorrhaging in this case?
Correct. None.
Can you have unilateral petechial hemorrhaging, like one eye versus the other?
You can, and I've seen it with people who maybe fall down and have part of their neck resting on something.
Okay. I mean, obviously you wouldn't have been able to see that in this case if there was, because we're missing an eye.
Yes.
Fair? Okay. Now, when it comes to asphyxiation, there's a variety of ways that a person can die. Asphyxiation basically just means you've died by lack of oxygen. Is that
Correct.
correct? Okay. Obviously, a person could be strangled. Am I correct?
Yes.
All right. Smothered.
Yes.
Could have just compression. I don't know what we would call that.
They can have compression on their chest.
Yeah, that's what I meant.
More common.
Thank you. Yes, absolutely right. So something, you could be working on a car, it drops on your chest, and so that could cause asphyxiation because you can't expand your chest.
Right.
Right. You can, in some cases, have positional asphyxiation.
Yes.
Right. Just the way however your position is cuts off your airway, or your blood vessels.
Yes.
Okay. Obviously, drowning, right, would be an asphyxiation as well.
Yes.
And hanging.
Yes.
Right. Anything else that you can think of?
There's a chemical sort of asphyxiation, carbon monoxide as well.
Sure.
Choking is also considered asphyxia.
Okay. Now, are second opinions, are those something that's common in the practice of medicine?
Increasingly more so, yes.
Okay. And so certainly in the context of like surgery or cancer treatments, much more right? The more significant the event. I mean, somebody says, "Hey, you need to get a heart transplant," and they might say, "Oh, I might want a second opinion on that."
Right.
Fair. Okay.
Yes.
But you wouldn't say there's anything inappropriate about those.
No.
Right. In fact, that's one of the reasons why you document as carefully as you do. Is that fair?
Exactly. I want someone else to be able to understand my report.
Absolutely. Okay. Now, you're aware that Dr. Michael Bodden also reviewed this case.
Yes.
Correct? And I know that you spoke with him on the phone. Is that correct?
I did. He called me.
Okay. Don't want to talk about what was said or any hearsay coming in, but you understand that he issued a report that had some disagreement with your ultimate finding. Is that correct?
Correct. And I did receive his report.
Okay. And I need to back up and give you a chance to tell us your findings. So what did you determine? I know we've seen your report. What did you determine for cause of death?
For cause of death, I said undetermined.
Okay. And manner of death?
Manner of death was also undetermined.
Okay. Now, are you familiar with Dr. Bodden?
I am.
All right.
I don't know him personally, but I definitely know of him.
Sure, you're familiar with his work. Is that fair to say?
That's fair.
All right. I mean, you read his book as a
teenager, yes.
Right. He's been around for a while. Is that fair?
I believe so, yes.
All right. You understand that he found the cause of death due to traumatic asphyxiation
I did.
and a manner of death homicide.
Yes.
And did you have a chance to enter? You reviewed his findings?
I did. I read what he had written.
Okay. And you don't believe that there is the body doesn't tell enough of a story to come up with those findings. Is that fair?
That's fair to say, yes.
Were his findings? They're not excluded by your autopsy, are they?
No.
All right. You just don't believe. You have a different confidence level, and you're saying I don't have an opinion that rises to that level, and he does. So is it fair to say that's your disagreement in this case?
Yeah, it's a differing medical opinion.
Okay. That's all I have for you. Thank you.
Ladies and gentlemen, we're going to take our mid-morning recess at this point. Please remember that admonition I've given you. Don't talk about this case with anybody. Keep an open mind until you've heard all the evidence, and thank you for not using your cell phones. We'll be in recess for approximately 15 minutes and try to be back on the record a few minutes before 11. We're in recess.
All right, please.
Dr. Cruz, you can step down. We're in recess, folks. I'll see you back a little before 11. Fair?
All right, please.
Please be seated, folks. We're back on the record following the morning recess. Dr. Cruz has retaken the stand, and I may remind you, Doctor, you're still under oath. Council may continue their direct examination. Or were you through?
I was through.
Cross?
Yes, Your Honor. Thank you. Good morning, Dr. Cruz.
Good morning.
I'm going to try to make this in a logical order, but I might be jumping around a little bit, so you'll have to excuse me. Initially, when you're presented with the body, you stated all the findings you do in an internal examination and an external examination. Do you have, and I'm not asking what the conversations are about, but do you have conversations with law enforcement or any other persons when you receive a body about the circumstances surrounding the death of that person?
It depends on the type, but yes, we do. That does occur.
So what type of information do you typically receive on that? Could you explain that?
It depends. It's not something that happens regularly. It just, if I need information or law enforcement may want to attend, they provide information. They'll provide information about the circumstances. So, for example, where a person was found, I like to know how they were positioned when they were found. Oftentimes they'll bring photographs of the scene, so I'll see those as well. Then they'll provide any information that they may think is necessary. If it's a gunshot wound, I may ask additional questions. That just kind of depends, but it's really, I ask whatever I think might be helpful for me in the autopsy.
Now, you stated that you don't like to get into times of death because of the difficulty in determining that based upon an autopsy. Did you have any information from law enforcement as to when they believe that Ms. Gowan became deceased?
I did know that they said that she had been missing for roughly 2 weeks, I believe it was.
And did they state that she was possibly last seen on February 13th or even February 14th? There might have been sightings of her as well.
Yes, I heard 13th and 14th.
Were there multiple sightings on the 14th, to your knowledge?
I don't recall.
Okay. When the body was presented to you, there were, on one of those photographs, there were brown paper bags on Ms. Gowan's hands. Can you explain that?
Paper bags will often be placed over the individual's hands before that body bag is sealed. The purpose of the bags is to preserve any potential evidence that may be on the hands. The body is in the bag for an extended period of time. There can be condensation and blood. So really it just protects those hands in case you want to take anything for evidence.
Did you collect any evidence from Ms. Gowan's hands in this case?
I believe I did. I just want to check all my pages are out of order. Yes, so clippings from the fingernails of both of the hands were taken. So the most distal part of the nail and the clipper itself were taken as evidence.
Were they sent off for DNA testing, or do you know what happened with those clippings after you took them?
No, I do not know what happened.
But it's something you do in order to preserve potential evidence in any type of case that you're doing, correct?
If it's appropriate, it's standard protocol for our homicide cases, and then up to my discretion on other cases.
Talking about the blunt force injuries on Ms. Gowan, specifically her scalp and head, do you have any indication of whether they could have been post-mortem, meaning after death?
Usually in the post-mortem setting, the large contusion like that shouldn't occur. There are times where maybe there can be some bleeding just from the tearing of the blood vessels. It's in my opinion that they did happen in at least the peri-mortem setting, so either as she was dying or before she died.
But it's possible that it could have been post-mortem as well.
There is the possibility, yes.
Again, going back into your favorite topic of timing of death, is there anything that you can view under the microscope that might be able to help you determine any potential time of death?
So there have been studies and attempts to try and determine time of death with looking under the microscope. I don't utilize any of those techniques, and to my knowledge, none of them have been validated.
But what would a person who does believe in utilizing that tool, what are they looking for?
Some of the things that people can do, especially when you're thinking about injury, you can look for evidence of healing to see if the person lived after they sustained an injury, if you know when an injury occurred. Other things people look at, maybe looking at fluid in the eyes. You can look at chemistry that way. Those are some things I do know about. The main things we do look at is the settling of the blood after a person dies, and in rigor mortis, which is the stiffening of the muscles. Those are classic things we look at to see when a person died, but beyond that, it's quite difficult.
Well, you segued perfectly into my next question. Can you talk about both liver and rigor mortis and also lividity and explain that to the jury?
So rigor mortis is the settling of blood to dependent portions of the body after you die. So after your heart stops pumping, that blood just settles according to gravity. It goes as far as it can, and it will go to those blood vessels that are on the surface of the skin. So you actually see, could be like a reddish, purplish discoloration from that blood in those engorged vessels on the surface of the skin. That blood is fluid for a certain period of time, meaning it goes according to gravity one way. If the body moves again, it can move according to gravity that way. After and it's all about rough, 12 or so hours, that lividity becomes fixed because those blood vessels start breaking down and the blood can't move in and out of them freely. So you see that pink-purple discoloration according to gravity, even when you've moved the person so that gravity is actually in a different spot, if that makes any sense. So that's lividity. So it comes fixed at about 12 or so hours. It starts right after you die. Rigor mortis is the stiffening of the muscles after you die. So once you die, you're still using up a little bit of energy, you have bacteria and whatnot. Once that's fully used up, you actually are frozen in the spot in which you're positioned. That also happens just about right away after you die. And then it becomes fully fixed over about 12 to 24 hours, really stiff. After about 24 hours, it'll start to go away because then you're starting to really decompose. Lividity will stick around for a bit longer and essentially will stay until you can't see it anymore, until a person's so decomposed.
When we talk about lividity and specifically the fixing of lividity, if a person were to have an injury, a soft tissue injury on the anterior or the front of their body, would that be affected as far as your potential findings if there's fixed lividity on the posterior or back of a person?
Could you say that again? I'm sorry.
I apologize. Would lividity settling in the posterior of a person affect any interpretation if there was an injury on the anterior portion of a person?
if you have injury on the front of a body and the blood settling to the back of the body, I should be able to appropriately interpret their wound.
So it doesn't matter if the blood has fixed and pooled in the back of a person. If there was an injury to the front of their body, you would be able to see and interpret those injuries.
Yes, for example, a bruise or a contusion, that blood should still remain in the soft tissue.
So you just stated that lividity fixes typically in 12 hours, but it could be greater or shorter depending on a number of circumstances such as temperature.
Yes.
So if it's a little bit cooler outside, then lividity would take longer or shorter to become fixed.
So in terms of lividity, that one's rigor might be more so slowed down with the cold and the hot. It's just really hard to say because there are those external factors, saying like the outside environment, the outside temperature, and then you have internal factors as well. I don't know what temperature a person's body was. I don't know what kind of clothes they were in, things like that.
Dr. Cruz, do you have any experience in your career dealing with decomposition of a body? Let's just say that it's been exposed for more than 36 to 48 hours post-death. Do you have any experience in that?
Yes.
How many cases do you think you've had in your career where you've had, for lack of a better term, a body with advanced decomposition?
I've had many, I would say. I don't know an exact number. Especially in my training, we even had just rooms where people were just decomposed because we had so many. So I've had people who are decomposed inside, outside, all different sorts of environments for extended periods of time.
So while it may make interpreting your findings a little bit more difficult, it's not something that you have absolutely no experience with. In fact, you're quite experienced in that. Is that correct?
Correct. There was a point made during my training to make sure I was at least exposed to as many decomposed people as possible because they're difficult cases.
Dr. Cruz, I'd like to move on to talk about strangulation. Can you describe a typical case of a strangulation of one person on another or against another?
So in terms of manual strangulation?
Manual strangulation and any constellation of injuries you anticipate to see.
So in terms of manual strangulation, there are a number of findings that I look for and most often see in cases that I've had where there's been strangulation. In terms of external findings, there should be injuries on the neck because that manual strangulation involves pressure on the neck. They can be abrasions or contusions. There can be contusions and abrasions from the person scratching themselves, trying to remove the other person's hands from them, or it can be from the person's hands or their nails on that other person's neck that they're strangling. I often see contusions from the pressure. Contusions occur when there's pressure on the skin and it causes the adjacent blood vessels to break, so you get bleeding into the soft tissue. In line with that, we have contusions or bruises that are visible externally on the surface of the skin, and those will correspond to contusions or bleeding into the soft tissue or those strap muscles of the neck, which is why I did that careful layered dissection in this case, looking for any sort of injury to those neck muscles. Pressure is often pointed in the way of like it's a single finger. So there is, at least in my experience, usually bleeding within those muscles of the neck, and that's how our training has taught us. It's something that we look for. In addition to just those neck findings, we look for the petechiae on the face. I often see petechiae in the mucosa of the mouth. I'll see them in actually the whites of the eyes, and then on the insides of the eyelids. I'll also see them in the periorbital region of the face, so around the eyes, really anywhere above the neck. So those are kind of the classic constellation of findings that we have when we're looking for someone who has been strangled.
Would you anticipate to find, in addition to all those injuries, you would anticipate to see any fracturing of a hyoid bone, any fracturing of cartilage in the neck area, or any injuries to the larynx?
So in addition to the muscles of the neck, you have a number of different structures. The hyoid bone is this bone really up high on the neck below your jaw. And then you have cartilage within the airways of the neck. Those can become injured or fractured as well.
So out of the roughly 15 to 20 things you just stated, did Ms. Gowan have any evidence of any of those injuries?
No.
I'd like to talk a little bit about the state's direct examination with their bilateral occlusion of the carotid and jugular artery and vein. Can you explain that a little bit more clearly to the jury, just so we understand what the state was talking about?
With the absence of petechiae, or just
I apologize. Where, for lack of a better term, the sleeper hold. Can you explain exactly what has to occur for that to actually happen?
So I'm not trained in jiu-jitsu, so I'm not entirely sure what the sleeper hold entails. However, consciousness can be lost whenever the blood flow to your brain is affected negatively in some way. So when you have pressure on the neck, we had that little bit of pressure we were talking about with the petechiae in the eyes, because the vessels become engorged and they burst. When you have a little bit more pressure, that's when we're affecting the blood flow actually to the head. And once you have stopped or reduced that blood flow to the head, you're reducing oxygen delivery, and then that can cause a person to become unconscious. They can regain consciousness, so that's why if someone were to die as a result of it, that pressure would have to continue for longer than just a few seconds.
So if I'm understanding you correctly, if a person was doing this sleeper hold incorrectly or maybe took off pressure for a moment, you would not anticipate a person losing consciousness or dying within those few seconds.
Within a few seconds, unlikely. It can occur considering what happened leading up to that, but that person would regain consciousness in the very least.
Can you describe how long it would take for a typical person to be strangled manually, not in this bilateral occlusion of the arteries and veins?
Manual strangulation and timing, which I guess is obviously a theme in forensic pathology, is difficult to determine because it's often not consistent. So there's a struggle, some pressure is applied, someone may lose consciousness, they may regain it again. But in general, say we're dealing with maybe more consistent pressure, person can lose consciousness within seconds, and then you really need to have that pressure for a matter of minutes for someone to ultimately die.
Are we talking 2 minutes, 3 minutes, 5 minutes? Is there a generally accepted timing within the medical community?
There have been a number of different studies. It's difficult. It can be less than 10 minutes from what I can tell.
But 10 minutes is not an insignificant amount of time to be applying pressure to someone's neck manually, correct?
Correct.
You talked a little bit on direct examination about the changes in the liver to Ms. Gowan. Could you explain to the jury what you would expect to find for a person who is a alcoholic or chronic alcohol abuser if they were to not have any alcohol in their system and they would end up suffering from alcohol withdrawal?
So alcohol withdrawal occurs with someone who regularly ingests a significant amount of alcohol and then abstains suddenly from alcohol. It can happen within a matter of hours and then over a course of a day or two. The way alcohol works on your system is that it's a depressant, so it depresses your brain, your central nervous system. Once you take away that depression, your nervous system gets overexcited, and that results in some changes within your body that nervous system effects your heart rate, your blood pressure, can cause seizures, sweating, things along those lines. So people who are withdrawing can have hallucinations, they can have seizures, they can have really high blood pressure, they can have a really high heart rate. Most times that happens and it's a bad experience, but the person can survive. If they progress to something that's called delirium tremens, that's the most serious of all of those symptoms that occur with the alcohol withdrawal. That involves hallucinations and seizures, and you can have actual tremors. I think there are differing opinions on what the mortality rate is, but dying is definitely a possibility with delirium tremens.
If you have someone that you actually know to have died from delirium tremens, is there any physiological changes in their body that you can note during autopsy?
No.
So you couldn't say, look at their brain or look at their lungs or their liver and say that person died from alcohol withdrawal?
No.
So how do you determine that when you're doing an autopsy?
And so in terms of complications of chronic alcohol abuse is tend to how we will write it down or put it on a death certificate. That's what we call a diagnosis of exclusion. So you often have someone who's at home alone and they're dead in bed or just on the floor of their house. And I do an autopsy, may look at histology, do full toxicology, whatever I think necessary to essentially rule out every other cause of death. And then that's ultimately with what I'm left with. Sometimes you can have competing causes, and that's where my training comes in, what I think is appropriate as a doctor. But really, I need to rule everything out with the full autopsy.
Dr. Cruz, when you come to your ultimate opinion, what standard do you use and what standard is used in the medical community when you're giving opinions, conclusory opinions?
So in terms of the standard, it's really based on my opinion, my training, my medical expertise, what I personally think it's appropriate. At the end of the day, it is an opinion. People say within a reasonable degree of medical certainty. What that really means is kind of person dependent. We also have National Association of Medical Examiners guidelines that we may follow in certain cases to help us out.
So you personally, Dr. Cruz, what amounts do you give within a reasonable degree of medical certainty? What type of emphasis or meaning does that have to you?
It's tough. I mean, there's people have asked me percentages and things like that. I don't have a percentage. I like to be sure. And I like to base a lot of what I determine on my autopsy. I mean, that's really my role in everything. It's important to consider investigative findings, but I like to stick with the medical view. At the end of the day, it's my medical opinion. So I put a lot of time and effort, like with the expanded toxicology, to make sure I don't miss anything.
Did you have an opinion in the case of Eileen Gowan to a reasonable degree of medical certainty as to her manner of death?
No, I did not.
Did you have an opinion as to a reasonable degree of medical certainty as to Eileen Gowan's cause of death?
No, I made it undetermined.
So for both of those conclusions, you stated undetermined?
Yes.
Your Honor, may I approach?
You may.
Would you mark this defense exhibit 100? Dr. Cruz, I'm handing you what has been marked by the court reporter as Defense Exhibit 100. Do you recognize that?
Yes.
What is it?
So this is a quality assurance form that was signed by one of my colleagues in the office. As part of our standard office protocol, we have these forms, and our autopsy report and photos and everything, findings are reviewed by one of the other medical examiners for cases of homicide, and then when both cause and manner of death are undetermined.
And is that a fair and accurate depiction of the document as it sits in front of you?
Yes.
Your Honor, the defense would offer proposed Exhibit 100.
No objection.
Exhibit 100 is received.
So I'm not going to publish this to the jury. They'll have it back in the jury room, Dr. Cruz. But this quality assurance form was signed by Dr. Thompson. Is that correct?
Yes.
Dr. Thompson is the deputy medical examiner for the Iowa State Medical Examiner's Office. Is that right?
That's correct.
He is the second in command in your office.
Yes.
Do you know how long Dr. Thompson has been a practicing pathologist?
I think I think he's been practicing at least 10 years longer than me, which would put him at 15 years, about.
And can you tell us what Dr. Thompson went over when he filled out this quality assurance postmortem examination report?
So as part of the quality assurance form, he goes through different parts of my autopsy report in terms of, was my scene description accurate in terms of the information provided to me? We have a system where all of that's documented, so he had access to law enforcement reports and things like that. How I identified the person, if that's appropriate or not. Identification is one of the most important things we do. When he looked at the photos, if I accurately described clothing or medical therapy, if I missed anything, does everything seem accurate? Did my photos seem to accurately depict what was seen at autopsy? Are my organ or an internal injury descriptions appropriate? Did I do appropriate ancillary testing, like appropriate toxicology or anything else additionally? And then it looks at my conclusions and say, did I come to an appropriate conclusion? Is it consistent with everything that I had? Was it done in a timely way? Things like that.
So this quality assurance postmortem examination report is really a second opinion on your findings. Is that right?
I object to that. It's not a second opinion. It says that she's...
Excuse me. Can I see counsel? The objection is sustained, and Dr. Cruz's answer is stricken from the record. Next question.
So these quality assurances are done, you said, in cases involving manner of death as undetermined.
Where both cause and manner are undetermined, or where manner is homicide.
Okay. Jumping back a little bit, Dr. Cruz, I'm done with the quality assurance form. You stated that you did not believe that there was a ligature mark on Ms. Gowan. Is that correct?
I don't know if I was asked that question.
Okay. Do you believe there was a ligature mark on Ms. Gowan's neck?
I saw injury to her neck. I don't have enough information to characterize that as a ligature mark.
I believe counsel asked if it could have been markings from a zipper, and you said it was a possibility. Is that correct?
That's correct.
Ms. Gowan was last seen with a purse. Could that marking have been from a purse strap?
I would have to see it, but if it had a zipper-like component, sure.
Could it have been from really anything that was near Ms. Gowan's neck at the time that she died?
I would have to see it, but yes, anything that touched the skin that potentially could create that mark.
Dr. Cruz, is it fair to say that Dr. Bodden reviewed the same items that Dr. Thompson reviewed?
Yes, they had. He may not have had access to all of the things, but yes, the same report, the same photos.
And you ultimately, you've read Dr. Bodden's report and opinion, correct?
Yes.
And you ultimately disagree with Dr. Bodden's findings as to manner of death and cause of death. Is that correct?
Yes.
No further questions.
Hey, redirect.
Yes, Your Honor. First, Doctor, I'd like to talk to you about sort of the issue of alcohol withdrawal. Delirium tremens. I believe I heard you testify on cross-examination that as a person that is dependent on alcohol, as the alcohol comes out of their system, they would go through a progressively worsening set of circumstances, physically and mentally. Is that fair?
Yes.
They would progress. They'd have unsteadiness. They would progress into even having seizures. They would then go into a coma, and then they would die.
Yes.
Right. Would you expect somebody that could potentially be suffering from alcohol withdrawal to be up, walking around, steady on their feet 2 hours before death?
That would be unlikely.
How about 1 hour before death?
That would also be unlikely.
Would alcohol withdrawal cause blunt force injuries to your face, skull, other parts of your body?
Seizures can and falls can.
Okay. So if a person's having a seizure, would you expect them to have the constellation of blunt force trauma that you saw in the multiple locations on the body in this case?
I don't know if I could explain all of those injuries with a seizure.
Because if a person is on their back seizing and hitting their head, for example, then you'd see, obviously, you could potentially see contusions on the back of the head.
Correct.
Right.
And even in an enclosed space, there were more injuries than I would think would be consistent.
So fair to say you did not see any evidence of alcohol withdrawal being a factor in death in this case?
It being a diagnosis of exclusion, I couldn't rule it out, but I didn't have anything to rule it in.
And you didn't have access to like surveillance video of her walking down a hallway like an hour before she sort of goes missing?
I did not view any video like that.
Okay. So you would agree, it sounds to me like after listening to the discussion about manual strangulation, because of honestly the lack of a lot of findings, would you say you agree with Dr. Bodden that manual strangulation did not occur in this case?
That it did not occur.
This is not a case of manual strangulation.
It's something I could not completely rule out.
But you don't think that's what happened?
I don't think I had enough information for me to say that's what happened.
Sure. Because there's no strap muscle damage, there's no larynx issues, there's no hyoid bone fracture, there's no fingerprints. I mean, all the things that you would see from somebody putting their hands around the throat, they just were not present for you.
Correct.
Right. So if Dr. Bodden says he also agrees this is not a manual strangulation case, you two would not have a difference of opinion about that.
No, then we would agree.
Okay. Did you see any evidence of healing on the contusions and abrasions in this case?
Dating of contusions is difficult. I did not do any evaluation other than looking at them with the naked eye. So it's not really something I examined in depth.
Sure. How about the laceration?
No, there was significant drying to it from that postmortem interval, but no, I did not investigate, say, look under the microscope for any evidence of healing.
Okay. There's been some fairly significant medical literature discussing the use of chokeholds causing death by law enforcement. Is that a fair statement?
I believe so. I've read a few.
Right. I mean, that's because I know it's been a controversial area, so a lot of people are concerned about many law enforcement agencies have banned the use of chokehold or neck restraints because they can cause death. Is that your understanding?
Oh, I don't know about the banning, but I imagine that seems reasonable.
I'm sorry, I didn't mean the banning. Your understanding is those types of chokeholds or neck restraints can and do result in death?
Yes.
That's all I have. Thank you.
Anything else?
A few questions in regards to that, Judge. I apologize. Counsel just mentioned the laceration on the top of Ms. Gowan's skull. Would you expect to see a lot of blood from an injury like that?
Yes, the scalp is highly vascular, and there would be a lot of blood.
So are we talking, blood that would cover a 1 foot area? Or are we talking about a liter of blood? Can you tell us what you mean by there'd be a lot of blood?
Technically, you can kind of die of any sort of laceration from bleeding out, the scalp even more so. Over a long period of time, it could be enough blood that could potentially account to someone's death, if that helps describe it. But I've seen people fall downstairs and just be completely surrounded by a pool of blood from a scalp laceration.
Would you expect to see blood on a person's clothing with that type of laceration?
It would definitely be possible.
Dr. Cruz, do you agree or disagree with the following, that Ms. Gowan's injury was caused by the forceful compression of her beige jacket zipper's teeth against her neck with sufficient force to be imprinted on her skin, which interfered with her ability to breathe and caused her to die from asphyxiation and interference with blood flow to her brain?
I do not. I think I have enough information to support that or agree with that.
So you disagree with that statement and conclusion?
It's difficult because I did say that cause and manner were undetermined. I do not have enough from my autopsy to even come that close.
Thank you, Dr. Cruz. No further questions.
Anything else?
Just based on that. But you're not suggesting that that is not why she died. You're saying, in your opinion, you do not have enough information based on your training and experience to issue that opinion. You do not feel comfortable. You have no opinion. Your opinion is undetermined.
My opinion is I do not have enough information to determine how she died.
Thank you. Nothing further.
Thank you, Dr. Cruz. You are excused. Ladies and gentlemen, I'm looking at the clock, trying to determine how we're going to proceed through the rest of the day. And I think it's best that we take another early lunch. So we'll be in recess. And I'd ask you to try to come back 1 o'clock, and in hopes that we can be on the record at 1:15. I know I do have one matter at 1 that I don't anticipate taking any longer than 15 minutes, but if it does, we could be a little later. But try to be back at 1, and we'll try to be back on the record as soon as possible. We'll be in recess, and please remember that admonition. Keep an open mind. We'll talk about this case, and thank you for not using yourself.
All right, please.
Please be seated, folks, or you're free to leave. Mr. Munger, I'm going to scan this in.
I thought that just grabbed a sticker and I was going to go file it right now.
Thank you. All right.
now you can hear the sound.
Yeah.
And instead of unplugging it, because it's starting to look like it's, I don't know, like, I just don't want to mess with the cable so much.
Right.
And so it's like right now, so we don't have sound. Switch it up.
gonna choose tomorrow. Or, I'll sign them tomorrow. Because we don't know how late.
Ready for the jury?
Yes, Your Honor.
All right, please.
Please be seated, folks. We're back on the record after our lunch at recess. State may call the next witness.
Thank you, Your Honor. State calls Dr. Michael Bodden.
Good afternoon, Dr. Button.
Good afternoon, sir.
Do you swear or affirm the testimony about to give is the truth, the whole truth, and nothing but the truth?
I do.
Please be seated.
Thank you.
Counsel?
Thank you, Your Honor. Oh, probably need to grab some of those from you, Doctor.
Do you have water? Cup. Thank you. Thanks.
We'll get some up there for you. Can you state your name and spell your last name for the record, please?
Michael, B-A-D-E-N, Bodden, B-A-D-E-N.
All right. And Dr. Bodden, can you tell me a little bit about your educational background after high school?
Yes, I was graduated from the City College of New York, NYU Medical School, where I received an MD degree. And then my education in medicine was at Bellevue Hospital in New York City, first studying in internal medicine and then in pathology. And while in the pathology residency and chief resident in Bellevue Hospital, I became transferred into the medical examiner's office, which was located at that time at Bellevue Hospital.
And are you a board-certified forensic pathologist?
Yes.
And you've been so for quite some time. Is that true?
I was board certified in forensic pathology in 1966.
You said that you went to work for was it New York Medical Examiner's Office?
Yes.
How many autopsies have you performed in your career?
More than 20,000 medical examiner autopsies in the past, in the past 50 years or so. Thank you.
Did you prepare a CV, a curriculum vitae, for a jury's review?
Yes, I.
May I approach, Your Honor?
You may.
Thank you.
showing you what has been marked as State's Exhibit 14C. Does that appear to be a true and accurate copy of your curriculum vitae?
Yes.
Offer 14C.
Any objection to 14C?
No objection.
14C is received.
All right, just sort of want to go through a few career highlights. Dr. Bodden, you've been involved in some pretty high-profile cases over your career. Fair to say?
Yes.
All right. As I'm looking through your CV, I mean, are there any particular cases you want to note? Maybe that's a better question.
Well, the most meaningful was being chief of the forensic pathology panel of the United States Congress Select Committee on Assassinations back in the 1970s that investigated the deaths of President John F. Kennedy and Dr. Martin Luther King.
And you were involved in the Medgar Evers case?
Yes, Medgar Evers was a civil rights leader who was assassinated in Jackson, Mississippi, back in 1963, actually a few months before President Kennedy was assassinated. And I was involved in 28 years later in exhuming the remains and doing a reautopsy that led to the conviction of the person who did the shooting 30 years later.
And even more recently, did you involve in the investigation of the death of Kobe Bryant?
Yes, I was involved in looking into for the district attorney and looking into the death of Kobe Bryant. Yes,
and George Floyd up in Minneapolis.
Did a second autopsy. Yes.
Okay. I think the rest of your highlights, I don't probably need to talk too much. You've written, is it fair to say you've written in numerous books, many articles, taught forensic pathology?
Yes.
Okay. Could you explain for the jury what is your career like today, 2023?
Well, I spent actually 25 years working in the New York City Medical Examiner's Office. Rose to being chief medical examiner, then 25 years as the chief forensic pathologist for the New York State Police, and the past 10 years I've been in the private practice of forensic pathology.
So when you're in a private practice forensic pathology, fair to say you get contacted by either individuals or government entities and asked to perform a review of cases?
Yes.
All right. And is most of your practice today, would you consider that you're doing more review work, sort of second opinions, or you can still engage in primary dissection level autopsies?
Yeah, some direct autopsies, but mostly reviewing records from other people that have been previously examined or autopsied.
Okay. And can you explain, I know we heard from Dr. Cruz earlier today, can you explain a little bit about the importance of good photography and good documentation in the field of forensic pathology?
It's essential in the field, in medicine in general, in pathology in general, and whatever reports are made by pathologists in hospitals or forensic pathologists who usually deal with deaths outside of hospital or are undetermined at the time of death or unnatural, to document everything we do so that others can review the records. There's always, in diagnoses of cancer in a hospital, issues that may come up that require second reviews or even third reviews, looking at microscopic slides or photographs. So in order to properly function, especially as a forensic pathologist, when we deal with homicides, there has to be documentation by word, the autopsy report, by photographs, the autopsy and scene photographs, scene examination information, and the documentation has to be available for other medical examiners to look at. In a homicide case, there's initial autopsy performed by the county medical examiner, who usually works with police and prosecutors. There's going to be another medical examiner reviewing it for the defense, that to make sure mistakes haven't been made, to make sure that get a second opinion. But that's built into the law enforcement part of forensic pathology, that we have to provide enough information for others to review, to make their own independent opinions. And normally we welcome, if we're doing an autopsy, to have another pathologist come and watch or participate so that we are clear what the findings are, and then the interpretations are up to maybe other information also individually. However, most of the time when the first autopsy is done, there isn't another pathologist that comes to be at the first autopsy, because they don't know who the suspect might be. They don't have a lawyer to come and immediately get a second forensic pathologist. So usually it's customary for all homicides to have a second opinion done from the medical records that have to be kept.
Sure.
Autopsy report and the material I discussed.
And would you say your work today is primarily prosecution side, primarily defense side, or a mixture of both?
It's about, my work now is about 50-50 prosecution, defense, or in civil cases, defense or prosecution.
Okay. How'd you come to get involved in this particular case?
I was involved just a few months ago, in June, actually, early June of this year, because I was called by a brother of the decedent.
So Eileen's family reached out to you?
Directly, yes. They called me directly, the family of the decedent.
Right. And then I want you to give me a hearsay, but what was your task? What were you asked to do?
Well, they explained, which the reason he called was they were concerned about that the family thought that the sister had died as a result of injuries sustained by somebody else, and that the cause of death was homicide, and that the medical examiner was unable to determine the cause of death.
Okay, and so you were
asked if I could review the matter.
Okay, and so did you agree to review the matter?
I did.
All right, and what sort of information did you review?
Well, I listened to what the brother said, and he sent me a police report that described the incident of how she was found and why they were suspicious that this was a homicidal death. And he then contacted the medical examiner's office and Dr. Cruz, who had done the autopsy, and she and the office sent me directly, at the request of the family, the autopsy report and the photographs that were taken at the time of the autopsy.
Okay. And did you feel like, with the information that you received, that you had enough information to render an opinion in this case?
On the basis of the police report, the autopsy report, toxicology report, and the photographs, I felt I had enough information to have an opinion, yes.
Okay. And once you decided that you had an opinion, did you put those in a letter report that was ultimately sent to my office?
Yes, I did speak to Mr. Haven, who called me. I told the family what my opinion was, and then he asked me to send that opinion to you.
Sure. And did you also contact Dr. Cruz and let her know that you were going to be issuing an opinion?
After reviewing material and I believe before I sent you a letter, which is a few days, I did call and speak to Dr. Cruz, and she was very professional and very forthcoming. I told her truthfully that she had done. I was very impressed with the extent of her autopsy and the way she did it, which I see lots of cases, and oftentimes they aren't. Rarely are they as good as Dr. Cruz. And I did tell her that I thought, in my experience, from the material that she had developed in the autopsy and the photographs, that I thought there was information there that persuaded me that that I could arrive at a cause of death.
Okay. And so you would consider that a professional courtesy to note, if you're given a second opinion, right, as a doctor, you would consider that a professional courtesy to at least let the doctor know that you're going to be issuing an opinion. Is that fair?
Yes, and also to discuss with her to what extent I agree or disagree, might disagree with the findings on a professional level.
Certainly. And did you have any issues with Dr. Cruz's autopsy technique?
No, I think she went beyond what the average competent autopsy would be. It was an excellent autopsy.
Okay. And any issue on her procedure?
No.
Did you feel like you had adequate documentation as a result of the autopsy that she conducted?
Yes.
Okay. And again, then you ultimately provided a report. Is that correct?
Yes.
All right. May I approach, Your Honor?
You may.
Show you States Exhibit 15B.
Yes.
You recognize that?
I do.
And is that a copy of your report?
Yes, this is a copy of the report I sent to Mr. Forney, who's working with you.
Sure.
The handsome fellow. And to Mr. Forney, on July 18th, I was originally contacted in the early part of June, and I sent this to you July 18th of this year.
All right, lost my train of thought because I let it get out of my hands. What's the exhibit number in front of you? Doctors at 15B?
This is 15B.
I'd offer 15B at this time, Your Honor.
Any objection to 15B?
No objection.
15B is received.
In a moment. And are the opinions that you have contained in your report, are they to a reasonable degree of medical certainty?
They are.
Okay. Now, you're not coming here for free. Is that a fair statement, Doctor?
Yes.
Okay. So, can you what's the arrangement that we have? What is your daily fee for becoming involved in a case like this?
Well, my daily fee out of state, I'm from out of New York State, is $8,500 a day. So my total charge from sending a report from conferences and for yesterday and today, I believe it would be about $17,000.
And for a forensic pathologist of your training and experience, especially in cases such as this, is that a fair and reasonable compensation amount?
Yes.
Okay. So, do you have an opinion as to cause of death?
Yes, I do.
And what is that opinion?
My opinion, as I expressed in my letter, my opinion letter was traumatic asphyxia due to neck compression.
And do you have an opinion as to manner of death?
Yes.
And what is your opinion?
Homicide.
Okay. Now I want to take you through, can you put up 8? Take you through some photos. So sort of warning everyone, we're going to have some autopsy photos coming up. Did you request us to provide certain photos for the jury that would help you with your explanation of the injuries in this case?
I did. I pointed them out in my letter to you.
Certainly. And
were
then,
helpful.
And then after we spoke last night, you asked us to add 2 more. Is that
Yes.
fair? Okay. By the way, when was the first time you and I met?
Last night. I'm thinking of the restaurant, and I won't go through that.
Right.
But it was interesting.
Right. So I think we've spoken on the phone before that one time when we agreed we would hire you. Is that
Yes.
correct?
Yes.
And then last night was the first time we ever actually talked about this case.
That's correct.
All right. Let's start with 8A. Requested permission to publish these, Your Honor.
Granted, and I have it up on my screen, but I don't see it on the other screens. So Claire, I may need some help here, but Mr. Forney, are you bringing it up on?
It's up on my screen. If you can see it, that must be.
I'm going to clear it off, and I'll try again.
Power down over lunch. Yes.
Sometimes it takes just a minute.
There we go. Thank you. Please continue, Mr. Wilbur.
Okay, so we're now looking at photograph 8A. What of significance do you note in this exhibit?
May I
If you need to stand.
get out? And I don't have a good view from here.
Certainly.
Your Honor. Can I?
I don't know if this is going to
Oh,
help.
can I stand up and?
You can certainly stand up, or you can view them.
Okay.
If it's easier to stand, go ahead and stand.
Yeah, I think it'd be easier to stand. Thank you, Your Honor. Without blocking anything.
You're fine.
Yes, this is the clothing that Ms. Gowan was found in and brought to the medical examiner's office in the blue body bag. And it was what she was wearing. And the police at the scene had put bags on the hands to protect the hands and fingernails for any evidence that might be present, any trace evidence. And what impressed me most with this photograph was that she was wearing this zippered jacket because that caused certain damage to her neck.
Okay. 8E.
Yes.
All right, so I think that's 8E, so are we looking at a portion of her neck at this point?
Yeah, we're pretty close here. The greenish discoloration is kind of early decomposition, which, although she was found about 13 days after she was noted to be missing, her body's in excellent condition because snow fell and preserved the body. This is the undersurface of the left side of the neck. We're very close. There's an arm here and here over here. And she's twisted around. So this is the left side of the neck, and there's a little ridge mark, little teeth marks there, which impressed me as being caused by the zipper that she was wearing on the jacket that she had on.
Okay. And 8F.
this is better perspective. This shows the left side of the face.
What exhibit we look at?
8F.
8F.
And this is the neck, and this shows the zipper imprint mark that I referred to, with the zipper teeth interspersed within the spaces. And what can also be seen here that Dr. Cruz mentions, points out in her autopsy report, is a fracture, a fresh fracture of a tooth. The left medial incisor, a fracture with hemorrhage in the fracture of the tooth, which indicates a blow to that area of the face from that alone. But this is the imprint of a compression imprint caused by pressure put on the zipper against the skin.
Okay. Now, Dr. Cruz referred to that as an abrasion with, I think she said periodicity. I mean, it had, different periods of its abrasion and then sparing and then abrasion and sparing. Would you agree with that?
I do.
Okay. Let's put up 8G. Okay.
This is kind of rough for family.
I know, doctor. We'll get through this quick.
This is how she appeared after the clothing was taken off. This is about 14 days now after she died, so she's in excellent condition. Except she does have some marks on the right cheek caused by rodent activity while she was in the outdoors. And the fracture of the tooth can be seen, and the mark on the left side of the neck is present. She had a mastectomy previously, and there are little rodent bites around part of the upper portion of that skin loss.
Now, when she's been out for potentially up to 2 weeks, 13 days or so, why would there be, some rodent activity, but maybe not? Why does it stop in that location or that amount?
Yeah, I think when she first entered the ditch where she was found, on her back, because the morbidity is on the back side, she's laying there, rodents attacked area of injury. There was some injuries to that side of the head. Normally, in a day or two, the snow fell, and once the body gets that cold, below 39 degrees, and especially if there's snow present, the animal activity stops. Animals don't go in. And it's one of the reasons that in the morgues where bodies are kept are usually 39 degrees, 38 degrees, because not only animals but bacteria can't cause destruction, postmortem destruction in that cold environment. So that my opinion would be that when she goes into the ditch, there's some rodent activity which would have continued extensively if she were laying there for 13 days or 15 days normally, but because of the snow, the rodent activity stopped.
Okay. Let's go to, where are we on 8G? Let's go to 8J. What's next? Give us 1 second, doctor. All right, that's 8J.
J is a close-up of the abrasion injury on the left side of the neck, and I think was made by the tightening of the pressure on the zipper part of the jacket against the skin. showed severe pressure, compression pressure on the neck.
Okay. 8K. So it looks like maybe just a little different angle, same picture.
This is a little bit different angle, which shows the zipper from a little bit of a different angle.
Okay.
And the reason I think it's a zipper because of the sequential abrasions.
Okay. 8L.
This is another example of the zipper imprint.
I'm going to ask you, I'm not sure this is the one you'd ask about, 8N. So what does this indicate to you, Doctor?
This is just the reflection of the scalp showing multiple impacts from the inside of the scalp. That is, in the course of an autopsy, 2 incisions are made in the normal or basic autopsy. A Y-shaped incision that permits opening up of the abdomen and chest to look at all the internal organs, and an incision from the back of the head that permits reflecting the scalp forward and backwards. It's forward to be able to study the brain. And those incisions are made so that when the body is sewed up and shown to the family, we can't, those incisions are covered up and can't be seen by the family. So from the inside, you can see some of the 4 or 6 blunt impact injuries to the head that is described in the autopsy report. And there's one laceration of the scalp. That's the inside of the laceration on the left side of the scalp. That
give me a second, Doctor.
Right side.
Yeah, we'll put up another picture of that so you can explain that to the jury. That is 8M.
Yeah, this is still the inside. Yeah, this is now the left side of the scalp with the scalp pushed forward, showing the laceration in the skin and showing a fracture of the outside of the skull. This is the left side of the skull, which indicates a powerful blow to the head that caused laceration and a fracture of the outside of the skull. The inside of the skull didn't show it. There are 2 layers to the skull bones.
Okay. And then 8P.
Yeah, 8P shows the body still in the medical examiner's office, turned on the left side, and the lividity, this settling of blood on the back, maroon with beginning decomposition changes, green and yellow from bacteria underneath, shows that she was laying on her back the whole 13 days. So that the pressure on the neck was not caused by being against the ground, it was caused by something pressing from above. And on the upper back, there's a glue-type imprint that I think shows up better in the...
Oh, it's 8Q?
That Dr. Cruz took a photo of. This groove here with discoloration that matches the color and the shape of the collar of the sweater that Ms. Gowan wore underneath the jacket that she had on. So this is different color and matches that.
You close that down for me. Okay, think that'll conclude our pictures. If you want to retake your seat, Doctor.
Thank you.
Your Honor, we haven't yet published Exhibit 9, which is the coat. May I do that at this time?
You may.
Thank you.
Doctor, I'm going to ask if you could just examine Exhibit 9.
May I, Your Honor?
You may.
Thank you.
Examine
Yeah.
Exhibit 9 and compare it as we're looking at Exhibit 8K. Is it your opinion that that zipper is consistent with the injury that you see on her neck?
Yes, I think these teeth made those marks on the neck that are seen in the various phrases, images, and by twisting and pushing up under the chin, which also, with also the sweater underneath, that caused some pressure against the back of the neck by the twisting motion of grabbing and pushing this up against the skin and compressing the neck and compressing the zipper against the skin of the neck hard enough to cause the serial bruising.
So if you had this, would you agree this is a fairly puffy collar on this?
Yes.
Doctor? So if you had a coat that was being twisted, one side zipper in, one side zipper out, and it was being twisted, would that explain to you why you would show zipper marks on one side of the neck and no marks on the other side of the neck?
That's correct. Although the pressure of the coat would be on both sides of the neck, the zipper mark would only be at the point where the zipper touched the skin.
And in fact, have you seen in your experience, Doctor, other imprints of items as when somebody has had a shirt, a sweatshirt, or an item compressed, kind of imprinted into their skin?
Yes, usually in a neck compression. When I say neck compression, not necessarily fingers, which is manual strangulation, but in pressure with a forearm or the elbow around the neck, the chokehold, carotid sleeper chokehold, especially with the forearm, which is wide, anything that gets trapped underneath, like a chain on jewelry, or different kinds of clothing will be compressed against the skin and show that at the time of the autopsy. But if there isn't anything underneath, usually with that kind of blunt compression of both sides of the neck, it leaves no mark on the body. It prevents blood from going to the brain, and in 10 seconds, with no blood going to the arterial blood doesn't go to the brain, the person will pass out, and that's why it's been used by police agencies with difficult persons who are not cooperative to pass out long enough to put handcuffs on. It's about 10 seconds or so, and then the blood flow starts and everything is back to normal. But if that's left on for more than a minute or two, that will cause death.
Okay.
That obstruction of the arteries going to the brain.
And then, doctor, and
it leaves no mark at the time of the autopsy.
I'll let you get those gloves off.
Thank you.
And would you get a similar, if you don't have like a chokehold type of thing, but the twisting of a jacket collar, would that create that same sort of double pressure, kind of full circumferential compression that could result in death?
Yes.
Is that your opinion that one of those mechanisms was used in this case?
Yes.
Okay. Have you seen asphyxiation cases of this this type before?
Yes.
All right. How many neck compression asphyxiation autopsies or examinations have you been involved with in your career?
Well, over the decades, more than 200 or 300 deaths from neck compression.
And as a result of this, I just want to make clear, your opinion is that the cause of death was traumatic asphyxiation by neck compression?
Yes.
And your opinion as manner of death is homicide?
Yes.
Do you have any opinion as to the identity of the person that would have caused this this injury?
No, that's out of my lane. Medical examiners determine, forensic pathologists, the cause and manner of death, but it's up to police, prosecutors, and all to find out who done. We don't describe. Our job is not to determine who done it, because we don't want to be biased in our findings.
Is it fair to say you don't even decide whether, you can say homicide, you're not even opining as to whether it's wrong?
Yeah, if somebody dies of capital punishment, we call that a homicide, electric chair or gas. It's up to the prosecutor, to you guys, to determine whether it's a crime or not. Not all homicides are crimes. Self-defense, capital punishment are homicides, but are not necessarily a crime. And whether it's a crime or not depends on the prosecutor.
Okay. Now, we had Dr. Cruz testify earlier today, and she sort of explained some of the mechanics of, I think you did as well, of neck compression, that you've got the jugular veins that sort of don't lie too deeply into the throat, and then farther in, you've got the carotid arteries.
Yes.
All right. So I think that's why she explained that petechial hemorrhaging you'll frequently see in manual strangulation cases. Can you explain why you would see petechial hemorrhaging in a manual strangulation and where you might not see that in a neck compression case?
Yeah. Yes. The petechial hemorrhages occur when capillaries burst. Tiny little capillaries. That's why they're tiny little dots, like a period on a newspaper or something, size. When there's manual strangulation, so that there are 10 fingers that are compressing the neck, usually, in most of the cases, not all, it compresses all the veins because they're low pressure, but not all of the arteries. So arterial blood keeps going to the brain, and it can't get back to the heart. And it backs up. The veins back up until they get to the capillaries, and they start to break and cause petechiae. Now, if the compression is firm enough and to cause the arteries to collapse, then there's no petechial hemorrhages. There's no petechial hemorrhages in hanging when the arteries are collapsed by the weight of the body. There's no petechial hemorrhages in the carotid sleeper hold when the forearm and the upper arm collapse the carotid artery. So if the carotid arteries aren't pumping blood, then there can't be any petechial hemorrhages.
And would you expect to see marks or trauma to the strap muscles with that type of compression?
No. Manual strangulation will cause hemorrhage in the skin underneath, in the muscles underneath the skin, and fractures of the Adam's apple and the larynx, the higher bone there also, from the hard pressure of the fingers. They do not cause, there's no damage when the forearms press just the sides of the neck, the carotid arteries, and not the front of the neck, as in carotid sleeper holds, or often when there's a bulky object causing pressure, like the arm, or bulky clothing causing pressure, doesn't leave a mark, whereas a thin ligature will leave a mark, but not a bulky piece of clothing.
And I think that's exactly what we heard Dr. Cruz testify to, that if you have a thin ligature, you're going to have a distinct ligature mark. But as the item that's causing the compression gets wider, it dissipates force. So you would have less distinct up to no marks, depending on the material or the width.
I would agree with the way she described it, yes.
Okay. In your opinion, in reviewing the documents and the photos and everything you did in this case, was Eileen Gowan was there obvious evidence of assault, that she'd been assaulted?
Yes, he was. I counted, and going through Dr. Cruz's report and description, as well as in the photographs, more than 33 separate impacts on the body. Arms, legs, face, head, and the trunk of the body. She was, I would interpret it as being in the struggle in which she was beaten.
Okay. Mason, obviously, I just want to get this answer. If a person is unconscious while they're having their neck compressed, would you expect to see signs of them struggling against that?
Your Honor, those questions are you have to ask the doctor what he sees rather than suggest what the answer is.
Overruled. I'll allow the question.
Could you repeat the question, please?
Certainly. Would you expect, if a person was unconscious while they're having their neck compressed, would you expect them to have signs of a struggle? I mean, I'm sorry, like clawing, or would they be able to struggle against that compression?
No. That oftentimes in ligature strangulation, the finger marks on the neck could be from the perpetrator or from the decedent trying to remove the article. But if somebody loses consciousness very quickly, as can happen in less than a minute, well, in 8 seconds or 10 seconds with a proper carotid pressure, then there's no struggle.
And again, have your opinions today here been to a reasonable degree of medical certainty?
Yes.
That's all I have for you. Thank you, Doctor.
Thank you.
Can I say, counsel, just real quickly?
Any bad words? Petechiae. You got that? That's a tough one usually.
Ladies and gentlemen, we've been out here just short of an hour, but I am going to take a short afternoon recess, and we'll try to get back in it'll probably be 15 minutes, but no longer. Please remember that admonition I've given you. Don't talk about this case. Keep an open mind, and thank you for not using your cell phones. We'll be in recess for 15 minutes.
All right.
Please be seated, folks. We're back on the record after afternoon recess. And just prior to our recess, the state had concluded its direct examination. Dr. Bowden has retaken the stand, or am I just doctor? He's still under oath.
Thank you.
Any cross?
Yes, Your Honor. Dr. Bowden, my name is Joe Reedy. I will be doing the cross-examination. Thank you for being here today. Appreciate it.
Thank you.
Some of the things I'll ask you may be a little redundant, but I'll try not to make it too much, okay? You did a good look at Dr. Cruzy's autopsy report, right?
Yes.
And I believe you said that going through it, even if you went line by line through it, she did a good job.
Yes.
And that you agree with everything she's got in there right up until her last line, correct?
Yes.
And it's her last line that you disagree with.
As I recall, at the conclusion, yes.
Do you need me to bring it up there so you can see it, to go over it again?
I'll
I'll be glad to.
Pardon me?
I'll be glad to if that would help.
No, I agree with her conclusion. I disagree with her conclusion, yes.
Because the line that you disagree with, based on autopsy and investigative findings available at the time of this report, the manner of death is undetermined. That's one of the ones you disagree with, right?
I have a different opinion than she has, yes.
Okay. And you know that there was a peer review of her report, too, that agreed with her.
That there was a doctor.
Your Honor, I object.
Yes.
Excuse me, just been
That's a violation of the order in limine. There's no peer review that agreed with her. We're back into the second opinion stuff. I object to ask that question and answer be struck.
The objection is sustained. Any answer is stricken. I don't know if there was one, but any answer is stricken. And Mr. Reedy, you're free to ask any questions concerning the quality assurance, Exhibit 100.
Okay. You understand that there is a quality assurance postmortem examination report form filled out by a doctor, I believe Dr. Thompson?
No, I'm not aware.
Never got a chance to see that.
No.
Judge, I think we already have it labeled as 100, but I have no idea where it might be.
I've got the court's copy, the judge's copy.
But not a numbered one. I have a dummy form here. On the other side, Jeff. Over here? Yes. Yeah, please.
You may.
Take a look at that one.
Yes, sir. You know, this does look a little familiar. It may have been attached to the end of her report, the autopsy report. I would have to look at the autopsy report.
Oh, okay, whether it was attached or not, you're looking at it now.
Yes.
And this is reviewed by a Dr. Thompson from the medical examiner's office, right? And he filled out a quality assurance postmortem examination report form, which is now Exhibit 100. Correct?
Yes.
And basically, what does that document say to you?
He agrees with Dr. Cruz.
Your Honor, I would offer Exhibit 100.
It's already received, counsel.
It was? All right, then I won't offer it again. And so we're talking about really the cause of death, the manner of death, the opinion portion of an autopsy, correct?
Yes.
And a lot of what you're basing yours on is, help me out on this, how many years experience?
I didn't quite get the question.
How many years experience do you have, Doctor? You got a lot.
Over 50 years.
Okay. You're basing it on your 50 years of experience, correct?
Yes.
And so when we start going through the individual items, which is what I'd like to do now, is if you were doing, there's several different forms of strangulation, correct? One of them that you talked about is manual strangulation.
Yes.
Okay. And you said that this is not a manual strangulation case, correct?
Yes.
All right. If it was a manual strangulation case, what would you expect to see?
Hemorrhage underneath the skin, fractures of the thyroid, the Adam's apple, the thyroid cartilage, the little bone, the hyoid bone above it, and petechial hemorrhages are often present, not always, but.
Scratching by the defensive type wounds by the victim? And by that I mean when they struggle, and then a lot of times they fingernails scrape the perpetrator, and then they would have something under their fingernails, right?
Oh, if there's a struggle, sure, that there might be something under the fingernails. It's not often found, but can happen.
Because manual strangulation, as in most forms of strangulation, is very it's hard for the victim, correct? It's they're kicking and screaming, basically, if they can.
Often happens, yes.
We have none of those, right? In this case.
None of what?
None of those signs. No petechia, no scraping. As a matter of fact, we don't seem to have any results at all for scrapings under the fingernails. We took them. Dr. Cruzy told us we took them, but where they went to, I don't know. Is that a fair statement, or did you see anything?
Well, I saw the fingernails on the photographs. I didn't see any evidence of, with the naked eye, of anything under the fingernails. But that's correct. Yes, to your question. We don't see any.
Normally they scrape them. They take the fingernail thing and they scrape them, and then they send that scraping in to the lab, and they try and see if there's any DNA from the perpetrator.
Yes.
Right. To your knowledge, was that done in this case?
To my knowledge, the specimens were taken because I could see in the photographs that the fingernails came in intact and then were cut off, which is done to send to the lab, but I did not see a result.
And I've already made a couple mistakes about what's been offered and stuff, but I don't believe there's any exhibit that I might have missed that had those in there either. You weren't.
I didn't find any either. That's correct.
So if we were talking manual strangulation, we don't have the things that you normally would look for and want to have in there, right?
That's right. There's no evidence of manual strangulation. Manual strangulation always causes injuries that can be found at autopsy. There weren't any.
And is the big difference between manual strangulation and the other form of strangulation is that you're using some kind of device or clothing or something? What's the difference between the two?
Well, there's neck compression. Not all neck compression is strangulation. The difference is in the application of pressure to the neck is to prevent blood from going through the carotid arteries to the brain. So there is no pressure on the Adam's apple. There's pressure on the sides of the neck, preventing oxygen from going to the brain, because if you can prevent oxygen going to the brain, the person will pass out within less than 10 seconds, which is the basis of the police carotid sleeper hold. And if the handcuffs are put on and the pressure is released, the brain comes right back to normal within 10, 20 seconds. If that pressure is left on for too long, less than a minute though, it can happen. The brain cells can die and the person can be dead. And it's therefore it has to be done very carefully.
Can we have Exhibit 8P put up? Doctor, and if it's okay with the court,
Excuse me, counsel. Excuse me, counsel. I don't mean to interrupt, but do you have the exhibits on your laptop?
Yes, sir.
And I think we got it.
Let me try this.
Can you make that large, please? Doctor, I think that's Exhibit 8P. Do you recall? It was one of the ones you specifically requested, I believe.
Yes, sir.
Right. And I think when you were talking about AP, you talked about that shows the settling of the blood after death and shows what position the body would be in after death. Is that a fair statement?
Yes.
And what do you call that, liver mortis?
Lividity, liver, LIVOR mortis, that is the settling of the red blood cells, which is the heaviest part of the blood, by gravity after death, in the position the person is in.
And how long does that take to solidify?
Well, it takes about up to 12 hours to settle in, and at that time, the first few hours, the first 6 hours or so, it can be changed around, but after 12 hours, it's settled and it's permanent. As opposed, it's like a snowball going down in a jar, and then you turn it over and the snow goes the other direction. If the person's laying in the back for 6 hours, it'll develop, but the red cells can still go back if the body's turned over. But after 12 hours, it's what's called, it's fixed. It doesn't change anymore because it starts breaking out of the blood vessels.
Okay, so 8P basically shows that within 12 hours of her death, she's laying on her back.
Yes.
And remains there for at least the next 6 hours, right?
Yes.
After that, she could be moved or changed or whatever, and it won't affect.
It won't affect that lividity, but it will then develop a new lividity in the new position.
Okay. In examining the body, did you ever see any new lividity?
No.
So it'd be your position that she's on her back within 12 hours, and she remains on her back until found.
Yes.
All right. And so, and would that be consistent with, what's one of her on her back that they find her at? Which one I mean?
Probably 2A.
Yes. What is on? Doctor, this is, I believe, Exhibit 8A. And it basically shows the position she was in when she was found. Is that a fair statement?
Well, presumably, but although this position is the way she's in the body bag when they put her in the body bag.
Okay, so the better picture would be the one where she's on the ground and we see her on the ground. Is that a fair statement?
Yes, although this is presumably she's on her back when she's found, and they put her in the body bag and she's still on her back. So she's not found this way, but she was something like this at the time that she was found.
Okay, fairly similar to this.
Similar, yes, sir.
Okay. And that would be considered consistent with the lividity that you found on her in all the photos.
Yes, sir.
Were there any observations that Dr. made that you disagree with, other than the final opinions?
Well, there was some minor thing that she concluded that he had hypertensive heart disease due to high blood pressure. And I found in reviewing the record that her heart appeared to be perfectly normal and high blood pressure. This has nothing to do with the cause of death, but it was just a slight difference of opinion on whether there was heart disease or not. She listed it as heart disease, but I didn't find evidence of that.
Doctor, I know that when we're in accident cases and other types of things, they always talk about the treating physician as being the better person. Would that be similar in an autopsy situation? A person who does the autopsy has the better look at things?
The person who does the autopsy has the best look. The interpretation of the findings and the role that a second review brings into it is more information than the autopsy physician had. And the reason a second review is done is because issues have been raised or new information has come in that permits a review to give more information of interpreting the findings. And a lot depends on who's doing the autopsy, you know.
Sometimes the information you get in a second opinion is far less, as you had in the Kennedy case, right? You got to the case and you said they didn't preserve a lot of stuff, they didn't take good pictures, they did a lousy autopsy, right?
The people who did the autopsy on President Kennedy were not as qualified as Dr. Cruz to do a forensic autopsy because they were hospital pathologists at Bethesda who had never done a homicide autopsy before, so that they made a number of mistakes in examining the president, which Dr. Cruz wouldn't have made, and which has led to continuing controversy as to the cause of his death and whether it's a conspiracy or not.
In fact, in the Kennedy case, you couldn't even find the brain, right? That was gone.
Well, the brain was examined, but you're right. It was kept by Robert Kennedy and then disappeared with the information afterwards. It was placed back into the coffin, into the gravesite with President Kennedy, is what I was told, but I don't know.
And what you came out with that is, I don't have enough here because they haven't given me enough. Is that a fair
Oh, no. I think the brain was missing for the review, but we had x-rays and we had photographs of the brain before it went missing, so that was important for the review.
You concluded that you didn't have enough, right? Was one of your conclusions that they did a lousy job and didn't give you what you needed?
They did a job that wasn't very good, but we had enough. It was me and 8 other chief forensic pathologists on the panel. We had enough to make our conclusions. There was enough information. Just as here, I think there's enough information to reach a conclusion. That doesn't mean it has to be exactly the same as Dr. Cruz had, what a conclusion was, but I think the autopsy report is excellent as far as preserving what the findings were, and the photographs, 100 photographs or so, were very helpful in documenting the findings. So normally we don't keep the brain. So you're right, the brain is missing, and that's the problem. But it isn't a problem for making a decision of the gunshot wound that occurred of the president.
Making an opinion. I believe the standard for a pathologist is beyond. What do you tell me? What is the standard that you use to?
Yeah. Beyond a reasonable certainty, yes.
And what does that really mean?
That's a very good question, because different people have different views. Beyond a reasonable certainty in some jurisdictions means 51%. To me, beyond a reasonable certainty means more than 95% accuracy, because if it's only 51% accurate in determination of the cause of death, then you're wrong 49% of the time, and that's not good. I prefer to keep more 95% at least, but up to 99%, because I don't want to call something a homicide that isn't a homicide, because it has all kinds of ramifications. But I don't want to call a homicide not a homicide, because that also has ramifications. So I want to be 99% sure in criminal forensic pathology cases.
What's the standard in the state of Iowa?
The standard may be, I don't know, maybe 51%.
You don't know what the standard is in the state of Iowa, do you?
Not specifically.
Because you're not licensed in the state of Iowa.
That's correct.
And you could not have done this autopsy in the state of Iowa, could you?
No. I could do the autopsy after the medical examiner is finished with the autopsy, because once the medical examiner is finished in Iowa and in all other states, the body then belongs to the next of kin. And the next of kin can have a second autopsy done without getting permission from anybody. They're the persons who control the autopsy. So whenever we talk about second autopsies in the media or whatever, it's always done at the request of the next of kin, except in the rare occasion when it's ordered by the judge. A judge can order a second autopsy, even if the second of kin, for example, if there's a possibility that the husband killed the wife, the husband is the next of kin, he doesn't want an autopsy, but a judge can order it, overrule him. But that happens rarely.
Because it's a little confusing to me in that an autopsy is considered a medical procedure, right?
Yes, except there are some states and some conditions where, medical procedures, you can do medical malpractice. It's hard to do medical malpractice charges on somebody who's already dead.
Doctor, on this stuff, I appreciate if you'd limit your answers to the state of Iowa, okay? Because we're talking about whether you could do it here in Iowa and whether it's a medical procedure here in Iowa. It is a medical procedure here in Iowa, is it not?
Objection foundation.
I don't know the laws.
Excuse me, doctor. That objection is sustained and any partial answer is stricken. You're free to properly lay a foundation.
I know, exactly the opposite, doctor. You don't know what the standard is in Iowa, do you?
That's correct.
Do you even know what the law is here in the state of Iowa?
That's correct.
Doctor, you've had what I would consider a celebrated or infamous career, haven't you?
Yes.
And infamous has a couple meanings, doesn't it? Sometimes it's good, sometimes it's bad, doesn't it?
Yes.
And you've had that happen, right?
Yes.
And you've been subjected to some of the most gruesome cross-examinations, haven't you?
Yes.
And my attorneys who treated you badly, didn't they?
Pardon me?
They treated you badly during cross-examination.
Oh, I don't consider that. I consider that cross-examination, I'm supposed to be treated as hard as possible for the purpose of the cross-examining attorney, that you have absolutely every right to make sure I'm not making a mistake.
I'm just referring to one case where I remember that the judge basically, I think, was ready to throw the defense attorney and you in jail. Was that Ebert or something like that? I'm not sure which one it was.
I don't remember that at all.
Okay, all right, that's fine. The cross-examination was by an Ed Medvene, Medvene. Does that ring a bell at all?
No.
Okay. Tell me about the OJ case, OJ Simpson case. You know I was going to ask that, right?
Well, somebody mentioned something about it at the.
I gave the heads up to the county attorney that I was going to ask that. I told him that I was going to ask it, and if you wanted to ask it first, that was fine.
Yes.
It was not the best thing for you ever, right? And as a matter of fact, you've made statements of you wished you hadn't ever taken that case.
No, that's not. I've never said that.
Did you testify for O.J. Simpson?
I testified for the defense, yes.
And he was found not guilty.
Oh, he was found guilty in the criminal trial. He was found guilty in the excuse me. He was found not guilty in the criminal trial and guilty in the civil trial.
And
right.
But it was in the civil trial where you told, under cross-examination, you said you had made a mistake in the original trial, right?
No.
You didn't?
No, I didn't. No, I didn't. Unless there's a specific point that was raised.
Well, it was concerning the timing on the stabbing of Nicole Brown Simpson versus Mr. Goldberg, who was stabbed first, and how long they survived after they were stabbed, or just their throat slit.
Those were issues in the case, but I don't remember changing my opinion. My opinion was the same in both cases, in both the criminal case and in the civil case. My opinion was the same.
Judge, we may need a break while I bring up the transcript from the civil case then. Because in the civil case, he withdrew his opinion and recanted.
First of all, Your Honor, I'd ask that the comments of Mr. Reedy be stricken. At this point, he shouldn't be allowed to testify that. If he's got something to impeach him with, he should impeach him with it. If he doesn't, he certainly shouldn't be making comments like that in front of the jury, so I object.
I apologize, Your Honor.
I accept counsel's apology and remind the ladies and gentlemen of the jury, statements made by attorneys, whether they be statements in the opening, arguments at the end, or statements to the court during the trial, are not evidence, and you should not treat them as such. I want to keep moving here, and I certainly want to allow you to do whatever cross you have.
Can we approach? Let me show you at least one thing, Judge, I could show. Maybe it would refresh his memory.
You can certainly do that.
Have at it.
You can always, as part of cross-examination, you can always try to refresh a witness's memory. In fact, you can do that on direct.
Doctor, I'm looking at a Los Angeles Times article, and it's titled, "Witness Backs Off Theories Helpful to Simpson Defense."
Once again, Your Honor, I'm going to object. If he wants to show it to him and see if that refreshes his recollection, then that's proper. But reading the article out in front of the jury at this point would be hearsay.
That objection is sustained. It's not appropriate cross.
I don't need to offer it. Judge, I need to mark it.
Or you could simply show the witness, Dr. Bodden, and see if it refreshes his memory.
Is there a point to hear?
The first line.
Okay.
And if it does refresh his memory, then you can take the statement back and ask him a question.
You refreshed my memory, and that may I comment on it? And that it says at time the attorney Medvine, throughout the cross-examination, at times becoming so combative that judge rebuked him. Yeah, that I was rebuked, but I wasn't.
How about the line before that?
Michael Bodden, always an animated witness, argued with the attorney.
Backed off his testimony.
We're still in the same boat, Your Honor. They're both reading out of the document that's not in evidence. If it refreshes his memory, thank you.
And I need him to read the document.
Oh, okay. I'm sorry.
Excuse me just a minute. If he's reviewing the document to refresh his recollection, then allow him to read the entire document. If it refreshes his recollection, then if it's a yes, then you can take the document back and ask him a question. If it doesn't reflect his recollection, then you need to move on.
Would you look at it?
Yes,
Specifically the first few lines.
yes, I apologize. May I read from it?
Not at this point, Doctor.
You can't read out loud from a document.
Okay.
Excuse me. Mr. Reedy, do you have a question for the witness?
I'd like him to read it first, Judge, because he keeps wanting to read it to us. If he just read it to
I'm
himself,
sorry. Excuse
it'd be
me.
fine.
I thought you meant read it aloud. Yes, I read through this.
And does that help you recall that there was some issue concerning your testimony?
Yes.
And go ahead.
I don't remember it, but that seems correct. That I backpedaled on portions of my testimony.
Thank you. That's all I want, Doctor. And so you agree that you did backpedal?
As best as I could remember back 30 years or 27 years almost. Yes. Okay. Yes, sir.
And OJ got found not guilty in the criminal case, the one where your testimony went in, and the one you backpedaled, the Brown Simpson family and Goldberg family took a tremendous verdict against O.J. Simpson, right?
Yes.
Okay, I'm going to take the document back now.
Thank you, counsel.
Describe a sleeper hold to me.
What's called the carotid sleeper hold is a means of restraining somebody who is being uncooperative. Police come to a situation where they want the person to put his hands behind his back. He refuses to. And in order to gain control, in some police departments, use a hold from behind where the arm is put around the forearm on one side of the neck and the upper arm on the right side of the neck, so that the windpipe is protected by the elbow. The elbow, nothing compresses the windpipe, and the only thing compressed are the carotid arteries on either side of the neck, which gives 90% of the blood to the brain. And by compressing the carotid arteries properly in the way it's meant to be, the reluctant individual would pass out in less than 10 seconds, about 8 seconds. During that time, the police can then put handcuffs on, and blood flows back, and the brain is not injured by that brief period. But if the pressure is left on too long, then the brain cells start to die.
A couple questions concerning that. You talked about it, that they would come from behind, correct?
Yes.
And is that really the only way you could put a sleeper hold on from behind?
Yes. That specific hold, the carotid sleeper hold, which is used by many police agencies.
Well, other than the carotid sleeper hold, is there any way to get pressure on both the carotid arteries at the same time without leaving marks?
Well, you can do that by a ligature around the, or by hanging, because the weight of the body is sufficient for a ligature being encircling the neck to cause collapse of the carotid arteries, so somebody free hanging, will pass out very quickly before he dies.
I thought in hanging cases, there was usually damage to the esophagus or to the front neck area where it was cut off from the oxygen.
Well, not usually, because in a hanging case, the ligature around the neck slips up to underneath the mandible, underneath the jawbones, so that the hanging compression is usually above the Adam's apple. Now, if it's a very wide, belt or something, it can extend down and cause damage. But usually the ligature mark in a suicidal hanging is above the larynx, above the Adam's apple, so it doesn't cause fractures.
Hey, in this case, I believe it's your position that the coat is somehow used to help with the strangulation, is it not?
With the compression, yes.
Right. And I know Mr. Wilbur got up and twisted the coat some. Would the coat have to be off the person then to do that, or on?
On the person.
And they would twist, what, the back portion of it then?
No, the front portion, to twist it around, and that also would raise the pressure under the jawbone, where this is this mark from the zipper is above the Adam's apple underneath the jawbone.
Well, part of what you just told me a minute ago was that on a wide thing, it wouldn't slip up. Well, the coat would be a wide thing, wouldn't it?
Oh, yeah. Well, leather. I'm talking about a ligature, a wide leather ligature. The coat is a wide thing, but it's soft, and like the forearm it's wide enough not to leave any marks on the skin. So that the carotid sleeper hold doesn't leave any marks on the outside of the skin or underneath the skin. Doesn't cause fractures, and it doesn't show up. It can't be diagnosed at autopsy. It has to be diagnosed by eyewitnesses or by video, by some kind of video.
You're confusing me, doctor, because we are at autopsy and we have no witnesses to this, correct? So, but you're saying it was this type of strangulation.
I'm going to object. First of all, he's never said strangulation. They keep trying to tie a strangulation case as a compression case, but he's not said there were no marks. He's consistently testified that there are marks on the neck, so therefore that's a misstatement of the record.
That's sustained, but Mr. Reed, just rephrase your question.
Judge, I believe I have the right to do that based upon his autopsy report. If you look at it, he talks about asphyxiation.
That's something different than strangulation. We've heard a lot of testimony from both Dr. Cruz and Dr. Bond today.
You talked about this being something that would be from behind. Would it be something that you could do to another person while in a vehicle together?
Yes. From behind, that's the carotid sleeper hold, but the forearm could be used against the neck from the front. But it would have to, well, let me try to, the grabbing of the coat from the front could cause pressure on the sides of the neck that would prevent the carotid artery blood from flowing.
So nothing to do with the forearm that you were trying to demonstrate.
Yeah, not the forearm is from behind, but in order to one could also compress the carotid arteries by twisting clothing from the front. And usually that won't cause any marks unless there was some pattern to the object being used.
Let's talk about those patterns. In an autopsy, doesn't the physician usually take the object and try and line it up and see that it matches? I mean, at least on CSI, they always are doing that.
Yeah, no, they never do that in real life, because if you take the object and you hold it up, you can contaminate. You'd be getting the person's DNA on the object, and that's proof that it was used or something. So the object is usually kept separate, but photographs are used to match up. For example,
When you looked at these objects, did they match up?
yeah, I think that the clothing matches up because of the zipper mark. If there were no zipper mark, the soft fabric alone doesn't leave. In this case, doesn't leave any mark.
So if the spacing on the zipper marks don't match up, then that's not the object. Would that be a fair statement?
The spacing isn't that significant, because the spacing between compressions like bite marks and all on the skin causes the skin to stretch in different directions. So there's never a 100% match. What we see here is the teeth marks from that match the zipper mark, and at different spaces, but the space between them depends on how much force was used, how much stretching there was of the skin, for example.
So if you took the coat and you tried to stretch it and you couldn't, would that say that would be difficult to match it up?
No, it isn't necessary to. A zipper pattern is a zipper pattern, and one could say maybe there was a different zipper that was used, and that might be something to discuss, but you can't eliminate this zipper from being the zipper that caused those marks, in my opinion.
So when you're 95% certain of something, you don't even know that that's the object that you said caused the damage.
In my opinion, beyond 95%, I like to be up to 99%.
You just testified that maybe it's not that zipper, right?
No. I'm saying that what your suggestion would be, that maybe another zipper could have caused it. Yes, I can't. I'm not matching the zipper to the mark by measurements. I'm matching the zipper to the mark because that's the zipper that's next to the mark.
Now, you'd agree with Dr. Cruzy that there was no internal damage to Eileen in this case, right? No internal damage on her neck. This was all surface damage.
Yes.
And you agree that everything in this case, other than what you're saying about the zipper, would not have caused death, correct?
That's everything other than the neck compression. There's nothing else that would have caused death. Yes, I agree with that.
And I believe you already said this, but sometimes I lose track of things. But you said the family contacted you and told you thought it was murder?
Yes.
And you took the case before you saw any of the pictures, didn't you?
I agreed to review the case for the family, yes.
All these wounds that are shown in the numerous Exhibits 8s, those were head wounds, right?
No, they were the head wound, there were head wounds. I think she says that there were 8 head wounds that she saw, but there were other marks, bruises. I had over 30 marks on the arms, legs, face, chest that she describes. She describes a whole series of them over the entire body, except for the back.
All right, let's just talk about the ones that head only, though. Head wounds bleed a lot, don't they?
No.
They don't.
No.
So there is an area that you disagree with Dr. Cruzy then. She said yes, I think.
Well, if she said that, they can bleed, but they don't bleed a lot because there's no major blood vessels, and they're only capillaries in the and small blood vessels. That's why, going back 100 years to 200 years, people could be scalped and still survive because the bleeding is from really little capillaries. It isn't like a carotid artery or something that would bleed.
So these wounds that you can see in the pictures to the head would not have produced a substantial amount of blood.
They produce blood, yeah, but not enough to cause death.
No, I'm not talking about death. I'm talking about visibility.
Oh, that is, there would be enough blood certainly to be visible, yes. No, there's one laceration. The laceration of the scalp would produce bleeding. The one tear in the scalp that caused a fracture of the underlying bone. But the other 8 or so bruises didn't open up any skin. It was all seen when the scalp tissue was reflected. It's on the inside of the scalp, not the outside, and they did not bleed very much. They bled enough to show that there was a blunt force impact with bleeding of little blood vessels around the impact, but didn't cause any accumulation of blood.
Have a moment, Chairman.
You may.
I just want to make sure so we're clear for the jury on this whole issue of spacing and zipper matching, etc. My recollection of your testimony on direct examination is that the zipper that is in Exhibit 9 is consistent with the marks that you saw on her neck. Yes,
That's my opinion, yes.
Okay. And you talked about skin as we get older, right? I mean, I get a little more, stretchy skin maybe than I wish I had, right? But as you pull, you can pull your skin up, right? Our skin is pliable.
Yes, skin is pliable.
So it squishes, it puts apart, so it can get folded. I mean, skin is very movable. So it would be almost impossible to, line a zipper up with that because there's no way to recreate what folds or stretches existed in the skin at that time.
That's right. You can't make an exact match.
And I sort of apologize for bringing the carotid sleeper hold into this courtroom because this is not a carotid sleeper hold case. Is that accurate?
That's correct.
There's been a lot of medical literature because of discussions about sleeper holds in law enforcement, and so it got brought up in that context. It is not, I just want to be clear, it is not your testimony that this is some sort of behind-the-back sleeper hold case.
That's correct.
Right? My understanding is that it's your opinion that there was some twisting of the coat from the front, right, which then caused like a full compression of both sides of the neck.
Yes.
And as far as like the blood on the head, I just wanted to ask if this scenario is consistent with the information that you saw in your review of this autopsy. If a person was knocked over the head hard enough to do what it did, right?
He's on redirect and he's leading the witness. He needs to ask the witness for questions, not give a scenario and then ask him if he's correct.
Your Honor, this is an expert witness and a hypothetical question.
And
not
just
on redirect. He doesn't get to do hypothetical questions.
He needs, I'm going to allow the question based on your cross-examination on this issue. And, but Mr. Wilbur, you need to ask it as a hypothetical.
Hypothetically, right, if a person is knocked over the head that causes that laceration, which would have some bleeding, and that stuns them or knocks them unconscious, right? I mean, I think we can all agree gravity goes down, right? So if a person falls down, they're going to be bleeding that way, and you can be over the top choking them with their coat. Well, I shouldn't say choking. You can compress their neck with their coat, leaving no blood on the head, no blood on the coat, all injuries consistent. Is that hypothetical scenario, is that consistent with the findings that you had as you reviewed this autopsy?
Yeah, I'm not going to.
I'm not saying what
the
you say
position of the body is, but yeah, one can have death and the injury, and especially if the body is in the snow for in the open, that blood can be. The first thing the animals do is lick away the blood. They like the blood, so blood may not appear at all when the body is seen. But yeah, a person can be compressed, and that can be compressed, lose consciousness, be hit in the head. I don't know which comes first.
Exactly.
I'm not putting them in order.
Exactly. You're not going to give an opinion that you can say order of bruise. You can't say this was bruise 5 and this was bruise 17.
That's
right?
correct. I'm not giving an opinion on the order of injuries.
That's all I have. Thank you.
Anything else?
No, Your Honor.
Thank you, Doctor. You are excused.
Thank you, Your Honor.
And released from any subpoena.
Your Honor, the state rests.
Ladies and gentlemen, we're going to take another afternoon recess, and we'll try to keep it at around 15 minutes. So 25, 20 till, we'll try to get back on the record. It may be a little longer than that, but it should be in that ballpark. Please remember that admonition I've given you. Don't talk about this case, and keep an open mind. We'll be in recess for 15, 20 minutes.
All right, please.
state where you should be heard.
I think we've made a prima facie case, Your Honor. The three counts are murder. I apologize. I think we've made a prima facie case. The three counts in this trial have been murder in the second degree. That has three elements: that the defendant assaulted Eileen, that she died as a result, and that he did so with malice aforethought. Malice aforethought requires this isn't a first-degree murder charge. We don't have premeditation. It just requires enough time for a person to understand what they're doing. The circumstances of death in this case, Cruz, Bodden, the photographic evidence indicates clearly that Eileen was assaulted. Dr. Bodden opined that she died as a result. The circumstances, especially considering Dr. Bodden's testimony that it would have taken the closing off of her, the compression of her neck for some lengthy period of time, indicates the malice aforethought. This wasn't just a snap decision. This isn't, again, a premeditation case, but we've certainly met the prima facie case on murder second. Count two. Abuse of a corpse. We have two elements. We have to provide proof that he either hid or buried or failed to disclose the known location of Eileen, and that's element one. Element two, with the intent to conceal a crime. In this case, the crime being her murder. He clearly, this is not a buried case, but he clearly put her in one location and directed law enforcement to another location. He knew where he had put her, and then, again, repeatedly failed to disclose the location when they were looking for her. I believe we've met the prima facie elements for abuse. Theft second, we have to prove three elements: that he took property belonging to another, that he intended to permanently deprive the owner, and that the property belonged to Eileen. Then obviously we have to prove the value as well. He's taken this, we believe we've established a prima facie case that he took the safe, contained $1,200 in cash that is supported by the $1,200 cash deposit. He also took her phone. He also took her purse. He also took her shoe. He also took whatever other items were in the safe. We certainly have proven a prima facie case to create a jury question on the value, which would go to the degree of theft. The only sort of wrinkle in the case, I think, is the territorial jurisdiction, with the FBI cast agent indicating that, for a 45-minute period of time, that the phones show that they're right around the state line, probably on the Nebraska side. Now I can't remember the code section, of course, but the territorial jurisdiction code section, it's either 8032 or 8023 or whichever one that is, indicates that the state has jurisdiction over any crimes when they occur wholly or partly within the state of Iowa. And the subsection of that is that if one element occurs in Iowa, then the state has jurisdiction. State versus Serrato, Serrato, which is a Muscatine County case, was a case that the court ultimately found jurisdiction to lie in Iowa, where the only element proven to have occurred in Iowa was the malice aforethought. And that was enough to establish an anchor for criminal prosecution. In this case, of course, it's different. In Serrato, the body was actually, I believe, found in Illinois, because Muscatine's on the Mississippi River. In this case, Eileen was found in the state of Iowa, and we also have that presumption that's in the law that says that if a murder victim is found in the state of Iowa, then they are presumed to have died in the state of Iowa. And so when you take a look at the territorial jurisdiction, the presumptions, and all the evidence that came in this case, we believe we have met our burden to get this case to the jury. Thank you.
Thank you, counsel. The state has made a prima facie case by presenting sufficient evidence to generate a jury question on each element of each of the three counts. As Mr. Wilbur stated, the count of second-degree murder has three elements. Element one is that there's evidence the defendant assaulted Eileen Gowan. Element two is Eileen Gowan died as a result of being assaulted. And three, defendant acted with malice aforethought. And the court finds sufficient evidence on each one of those elements to generate a jury question. With respect to abuse of the corpse, there is evidence of the two elements required in that count. One, evidence that the corpse was hidden by the defendant or the defendant failed to inform where the body was, and two, that there was intent to conceal a crime. And finally, with respect to the theft charge, that there's evidence, sufficient evidence, to generate a jury question that the defendant took possession or control or property belonging to another, and that the defendant did so with the intent to deprive that person, in this case Eileen Gowan, and that the property at the time of the taking belonged to Eileen Gowan or her estate. Thus, the court finds that that there's a jury question generated on each one of those elements of all three counts. The motion for directed verdict is overruled. Before I bring the jury back, Mr. Munger, obviously when the jury comes back, I'm going to be looking at you and having the defense present their case. There's been some discussion that I've had with you and counsel, and obviously I did not press one way or another until this moment whether or not your client was going to elect to testify. If he's not, I would like to make some record now in the presence of the jury, and then we can move forward. If you have any other evidence, fine, but if not, I imagine you'll be resting.
Yes, Judge, we intend to rest, and if the court would like to go over the rights that Mr. Brammer is waiving by not testifying, the court may, or I can do so if the court wishes as well.
Why don't you have a colloquy with your client, because I imagine it's something that you've discussed with him already, and if he'll be familiar with that discussion, and if there's something else I think we need to talk about, I'll do that afterwards.
Thank you, Your Honor. Mr. Brammer, you and I have had conversations about the right to testify in a trial against you, correct?
Right.
And we've had a fair and full discussion about all the pros and cons that would be available to you if you were to choose to testify. Is that correct?
Correct.
And it was also the advice of counsel that you do not testify on your own behalf. Is that correct?
Correct.
And you have been made aware that it is your decision, and it is your decision alone, and you have been fairly and fully advised of this right, and you are electing not to testify by your own choosing.
Yes.
No further questions, Your Honor.
Thank you, counsel. And I do believe you've covered what I intended to cover in any further colloquy. And Mr. Brammer, just a follow-up, which is just confirming what you've just answered in response to Mr. Munger's question. You believe you've had sufficient time to make that decision after consulting with your counsel, correct? Yes? You have to answer out loud.
I can't hear what you're asking me, so can you talk a little louder?
Well, then don't be if you can't understand what I'm saying. You've had sufficient time to review the discussion you've had with your attorney on whether or not to testify in this case, have you not?
Yes, I have.
And is it your decision that you not testify?
Yes.
Very well. Any further record by either counsel?
No, Your Honor, I'm satisfied. He knows he's got a right to testify and he has a right not to testify, and it sounds like he's electing not to. We're satisfied.
And again, Mr. Munger, it's my understanding that the defense has no evidence to present today. Is that right?
That's correct, Your Honor.
Very well. We're going to have the jury back momentarily. When they come back, I will confirm that the state has rested and concluded their case, and then I'll be turning to Mr. Munger and ask if there's any evidence, and you can respond to me at that time. All right? Claire, we need a jury. That's fine.
All right, please.
Please be seated, folks. We're back on the record after our second recess of the afternoon. Immediately before that most recent recess, the state had concluded its case and rested. I'm now turning to Mr. Munger on behalf of the defendant. Do you have any evidence?
Your Honor, at this time, the defense rests.
The defendant has now rested as well. That means, ladies and gentlemen of the jury, you have heard and received all the evidence. And we're going to take an evening recess. I know it's 3:45 and you're thinking, Judge, we could still work for another 45 minutes. But I know these attorneys well enough, and I don't know if that's sufficient time to take care of summations. And I don't want to keep you here too long. So we're going to recess until tomorrow morning, and it'll be the same time. If you all could be here at 9 o'clock, I'll try to be in the building at that time as well. And if we can be on the record at 9:15, that's going to be my intent. Please remember that admonition I've given to you. Don't talk about this case. Keep an open mind. And thanks again for not using your cell phones. We'll be in recess until 9 o'clock.
All right, please.
Please be seated, folks.